We live now?
Yes, sir.
Are we live? Okay. Are we live, Rupakji?
Yes, sir.
Yeah, I'm
Okay.
ready.
Okay. Thank you, G'day from Australia, and I am Dr. Raju Adhikari. I am the host and the moderator of this program. And on behalf of Science, Knowledge, and Technology Transfer Department, Nepal Science Foundation, NRNA, I would like to welcome all the panel members and all the audiences who are connected globally and watching this program from a different time zone. So thank you. This is our third episode of COVID-19 Science-Based Information Sharing Forum. We have had two sessions, very successful one, and now we are entering into the third one with a theme, which today's theme is drug and vaccine development. So we will be focusing our discussion on COVID drugs and vaccine development. The format of the program is that this program goes for 1.5 hours, and the panel members will have about 10 minutes for their presentation. And followed their presentations, I think we'll have a very interactive discussion among the panel members. And then the floor is open to Q&A for the global audiences. And before that, I think I would introduce some slides to introduce our panel members and also share some of the theme that we focus on today's discussion. So I'll have my presentation. Can I share my file, Rupak, bye? Okay, here it is. Just a second. Can you see the slides, everyone?
Yes.
Okay, thank you. As you can see, the flyer of this program, we have very distinguished speaker lined up today. And the theme of today's topic discussion is COVID-19 drug, vaccine, and cure. So Dr. Dinesh Gautam ji, he's a molecular physiologist, pharmacologist, and biotechnologist. He's working in US FDA, which is a highest authority for drug and vaccine approval globally. You know, it's in the US, it's one of the authorities. And he also had worked in Nepal for 15 years in agri-space earlier before coming over to US. Ms. Bimjana Biswakarma, she's a young researcher, a scientist. She's working in the area of immuno-oncology and drug discovery. And she is currently employed by Bristol Myers Squibb in USA. Dr. Dorna Rashali, he's an epidemiologist. He works in BC Center for Disease Control in Canada. He's a very well-known figure in diaspora professionals community for his long outstanding contribution for so many years. And I'm Dr. Raju Adhikari. I'm the principal scientist, honorable fellow at CSRO and chair of this Nepal Science Foundation Trust. And we have Banaji, the head of this science technology department, who is our special guest and who will welcome the team members formally after this theme presentation. So COVID-19, coronavirus, it's a household name. In the last 8 months since the first outbreak, we know many things, but we still don't know anything. We are very confused about this virus. These are some of the confusions people have in minds. Virus strain. Are these virus which we see over the last 18 months, are they of the same strain or are they different strain? The strain in America versus in China, in Nepal, are they same virus or the different virus? We still know that 15% of the people are not infected with this virus. We call it asymptomatic, very difficult to trace. How do we track and trace this? Drug and vaccine development has been the forefront of this since the outbreak of this COVID. And so much has been done, but we're still worried about its availability, effectiveness. If it comes into being used, how effective would they be? Another important concern is research and reinfection. Would virus keep resurging, flare up again and again, and reinfecting us? Once you have developed antibodies, can virus again infect you? Which is again a very concerned and a very tricky question. And what are the long-term side effects? There are many things we don't know, which time alone would tell about, such as cardiac and lung implication, hypoxia, and blood clot. We have got some preliminary observation reporting here and there, but we don't really know. This is another Pandora box we worried into the future going with the virus. So, so we've got lots of information about COVID. We are flooded with information, but we're still confused. We call it infodemics. That's a word coined by UN. And Dr. Dona Rasali has said this in the very first of his interaction earlier, that how confusing is this informatics. So let's go to the next slide. So drug and vaccines R&D approach, research and development approach. What has been going on in the last 8 months, where we are in terms of the development? This is a slide from FDA. I think Dr. Dinesh Gautam would be very familiar with this. And the reason why I'm putting these slides is generally for the audiences who are watching this program before they listen to the experts and technical jargon. I just wanted to give a little bit of flare up of the topics we are discussing and some basic information so that they are connected when the experts are talking later on. So this is a FDA from the website. One of the company in the US had identified lead drugs, and they said the principle of finding any drugs is that if any drug that interacts with the virus protein and human protein is a potential druggable site. So every place, so there's so many enormous potentialities and opportunities for any drug to be tested and to be effective. So it's just a mind-boggling game. And so USA had very early identified 47 old drugs already tested in human beings as the lead drugs. And they are being tried, and there are claims and counterclaims about their effectiveness as of today. Approved drugs like chloroquine, favipiravir, dexamethasone, remdesivir, these are some of the drugs and enzymes which have been approved. And whether we are in terms of their effectiveness, are they really effective? And what are the side effects? So these are some of the questions the panel would be answering to these questions. Vaccine. Vaccine is the holistic, people expectation is the ultimate tool for us to cure the virus. So is this? A lot of people saying that the vaccine is not ultimate. Virus will remain even after vaccinations. There are already 102 vaccines in trials. What are the differences in these vaccines? Why there's so many? Are they really different vaccine or the same vaccine made differently? 22 vaccines are in the final clinical trial, and 2 vaccines are already used. You have seen in the news that Russian vaccines already been approved and manufactured now, is in the process of manufacture. China has already approved one of its vaccine and have used already, even without completing the clinical trial. And they have been given to their service industry people who are in the front line, health workers. Is this good or bad? So vaccine generally takes several years to develop, but in this after COVID, the vaccine development has taken only in 1 year time. Is it good? What does it really mean? Booster vaccine, a lot of people are talking one vaccine may not work for another one, so why don't we develop a booster vaccine? So what do you mean by booster vaccine? What is for general public to understand what is booster vaccine? And ultimately, can Nepal develop drug and vaccines? Nepal always use the technology, but would our scientists be able, working in diaspora overseas and working together with the Nepal, be able to develop our capabilities in developing drugs and vaccines into the future? So I would like to show these slides for everyone. So this is just released yesterday by CSIRO, University of Queensland in Australia. It's a 1 or 2 minute slide where it tells you everything about the vaccine. So just hold on a second, it might take few seconds. Can you hear?
Yes. Nothing coming except for your voice.
Okay. Just
work and when might
can you hear?
Yes.
We can hear, but if you are
No
sharing the
visual.
video, then that needs to be shared as well. I don't think it is here.
Okay, okay.
This is the homegrown liquid.
Okay. I'll come back to that later, so during the discussion. So let me go on. This tells about the same story about the vaccine. So these are the Nepal's headline today. There are too many infected cases found, every day. It's growing in number. Now we have reached to about 4,000 of infected people. 500, there's a lot of government discussing about setting up isolation center to ventilator facilities to look after the infected people. And Nepal health workers are in the front line of the risk. Nobody knows how many of them are infected. Dr. Jose is the WHO representative of Nepal. He has said that we don't need to worry too much. If you look at the number of infected, the rate of infection in terms of overall percentage, he said there's nothing to worry. And he says COVID will remain forever. So he says also masks may not be necessary after the vaccine. So are these statements confusing, or are these statements very scientific? All these things, when people read all these things, are very confused. So we would like to hear from the experts, what does it really mean? So for Nepal, is Nepal prepared for pandemic? And does Nepal have COVID to deal with COVID infrastructure, tracing and test capacity? What's our capacity? And can Nepal contribute to drug and vaccine development? So these are some of the questions I would like to ask panel to uh, focus on. And before I invite the panel member, I'd like to invite Manaji, the head of the department, to formally welcome our distinguished panel member uh, uh, before we start their presentation. Welcome, Manaji.
Thank you. Thank you, Rajadai. Can you hear me?
Yep.
Yeah. Okay. So you already have mentioned the purpose of today's session. Welcome all our distinguished panel members to this third series of science-based information, COVID-19 science-based information, organized by the Skills, Knowledge and Technology Transfer Department in Nepal Science Foundation, the wing of NRNA. The purpose of today's session was, of course, look at from the different angle, and there is a lot of confusion still in the wider public. How far is the piece of string and where it is up to, and for planning day-to-day lives, businesses, communities, it has made it very hard. And with the expertise and experience within our diaspora and the experts back in Nepal, probably it will shed some lights and shed some clarity for everyone. Again, on behalf of NRNA, I would like to welcome you again, and for all the audiences, thank you for joining us in this session. And by the time that we conclude this session, we would have a lot of clarity from it in this domain. Thank you.
Thank you, Manaji. I think for your welcome remarks, and without any formalities, now we go directly to the panel members. So you have 10 minutes of presentation. So I'd like to invite first Dinesh Gautam ji for his presentation. Can you share your slides from your end, or do you want me to share the slides for you?
Yeah, I'll share. I modified a little bit, so I'll share the slides.
Okay.
So first of all, I would like to thank Dr. Rasali and Rajuji and Manaji for giving me this opportunity to talk about COVID situation. So I'd like to share my slide now. Okay, let me see. Can you see it now?
Yes,
Okay.
I can see. Yeah, put
Okay.
it on full screen, Daksha.
Yeah, I'll do that. Can you see now?
Yes.
Okay. So I'll talk about drug and vaccine development update. And So the views and opinions presented here are mine and should not be considered represent advice or guidance on the behalf of US FDA. आज मैले वास्तवमा ब्रिफली यसको हिस्टोरिकल ब्याकग्राउन्ड दिन्छु कोभिडको, त्यसपछि यसको जिनोम र स्ट्रक्चर र मेकानिजम के छ, किनभनेदेखि यो भ्याक्सिन र ड्रग डेभलपमेन्टको लागि इट इज भेरी इम्पोर्टेन्ट टु नो वाट इज गोइङ अन इनसाइड दिस भाइरस। अनि त्यसपछि क्लासेस अफ ड्रग्सहरू के छन् त पाइपलाइनमा स्टडी भइरहेका, र त्यसपछि भ्याक्सिन्सहरू के भ्याक्सिनमा अहिलेसम्म के भइरहेछ भनेर। So कोरोना भाइरस भनेको के भनेदेखि what is a coronavirus? Corona is a Greek word which means a crown or halo. We all know that one. And coronavirus वास्तवमा के छ भनेदेखि अहिले मात्रै देखिएको होइन। The first coronavirus was isolated, discovered in 1930s in domesticated chicken. And it is called infectious bronchitis virus. Infectious bronchitis virus, and the mortality was 40 to 90%. 1966 मा जुन अमेल्डाले चाहिँ इलेक्ट्रोन माइक्रोस्कोपबाट कोरोना भाइरसलाई क्याप्चर गर्नुभयो फर्स्ट इमेज। त्यो चाहिँ ओन्टारियो क्यान्सर रिसर्च टोरन्टोमा। सी इज अ ब्रिटिश साइन्टिस्ट बट सी केम टु क्यानाडा एन्ड डिड हर स्टडी एन्ड रिसर्च। एन्ड त्यतिखेरको त्यो इमेजलाई चाहिँ इट वाज कल्ड B814 and B81 was later recognized as IBV, that is a infectious bronchitis virus. So now we know that coronavirus are a group of related RNA virus cause disease in mammals and birds. र ह्युमनमा चाहिँ it cause mild and lethal form of respiratory infection. र पोल्ट्रीमा चाहिँ अप्पर रेस्पिरेटरी ट्र्याक्ट इन्फेक्सन गर्छ यसले, र क्याटल र पिगमा चाहिँ डायरिया गर्छ। कोरोना भाइरस belongs to a family of Coronaviridae. It has 39 species and 27 genera. And out of 39 species, 7 coronavirus cause respiratory infections in humans. And out of that 7, 4 of them can cause common cold-like symptom, and 3 of them can cause, we know that, SARS-CoV, which is severe acute respiratory syndrome. Another one is MERS, Middle East respiratory syndrome, and the current one is SARS-CoV-2, which is COVID-19. And COVID-19 caused by will cause severe acute respiratory syndrome, and first time identified in 2019 in Yuan, China. The 41-year-old man who was working in seafood market there. And January 30, 2020 मा WHO ले चाहिँ के छ भने पब्लिक हेल्थ इमर्जेन्सी भनेर डिक्लेयर गर्यो, र मार्च 11, 2020 मा WHO ले चाहिँ पेन्डेमिक भनेर डिक्लेयर गर्यो। यो मैले हिजो बनाएको स्लाइड हो। सो ग्लोबल डेथ अहिलेसम्म इट इज मोर देन ग्लोबल केसेस अहिलेसम्म मोर देन 27.7 मिलियन छ, र टोटल ग्लोबल डेथ चाहिँ इट इज 814 or almost 815,000 जति भइसकेको छ। र नेपालमा हिजोको अहिले भर्खरै हाम्रो के अरे राजुजीले देखाउनु भयो, तर यो हिजोसम्म चाहिँ नेपालको केस चाहिँ 32,533 केसेसहरू भेटिएको थियो, र टोटल डेथ चाहिँ 164 पुगेको छ। So COVID-19 is, what is COVID-19? The structure, it is enveloped RNA virus, roughly spherical in shape, 60 to 80, 140 millimeter in diameter. And the main contents, there are 4 major proteins are there. So one is called a spike protein, which is also called S protein, glycoprotein, membrane protein, M protein, envelope protein, E protein, and inside virus, there is a nucleocapsid, N protein, and single-stranded RNA. The RNA genome is about only 30 kb. And genetically, COVID-19 shares 96.2% sequence homology with bat coronavirus and 79% with SARS-CoV and 50% with MERS-CoV. So 96.2% यसले जुन सिक्वेन्स होमोलोजी सेयर गर्छ ब्याट कोरोनाभाइरससँग त्यसैले गर्दाखेरि अहिलेसम्म के साइन्टिस्टहरूले के भनिरहेको छ भने परह्याप्स यो चाहिँ ब्याटबाट ह्युमनमा जम्प गर्यो र त्यो चाइनाको त्यो वेट मार्केटबाट अनि त्यसपछि गएर के छ भनेदेखि अरू मानिसहरूलाई सर्यो। COVID-19 contains 14 open reading frames. त्यो ओपन रिडिङ फ्रेम्स भनेपछि त्यहाँबाट के छ भनेदेखि यिनीहरूले प्रोटिन बनाउँछ र इनकोड ओन्ली 29 प्रोटिन्स। इमेजिन हाम्रो बडीमा we have more 20 to 25,000 genes and 80,000 देखि 4 लाख प्रोटिन हाम्रो शरीरले बनाउँछ। हाम्रो एउटा सेलमा लगभग झन्डै 10,000 जति जिन छ र हाम्रो पुरै शरीरको विभिन्न सेल्सहरू चाहिँ 250 थरीका छन्। त इमेजिन त्यो हाम्रो शरीरको तुलनामा यो चाहिँ कति सानो छ भन्ने कुरो। जम्मा 29 प्रोटिन्स बनाउँछ एन्ड द 5 प्राइम तिर हेर्ने हो भनेदेखि दिस इज 5 प्राइम हियर। क्यान यु सी माई पोइन्टर एज वेल?
यप।
ओके, सो 5 प्राइम तिरबाट यसले 15 वटा प्रोटिन बनाउँछ र अरू चाहिँ 14 वटा प्रोटिन चाहिँ यतातिर बनाउँछ र यसको मेन प्रोटिनहरू चाहिँ के छ भनेदेखि यस प्रोटिन यहाँ र एन्भलप प्रोटिन, एम प्रोटिन र एन प्रोटिनहरू बनाउँछ। त्यसमध्ये अल्सो दे अल्सो कोड सेभरल यो के छ भनेदेखि 15 नन स्ट्रक्चरल प्रोटिन्स पनि बनाउँछ 5 प्राइम तिरबाट। सो आई एम नट गोइङ टु गो इन डिटेल्स अबाउट अल दिस थिङ्स, अलिकति बुझाउनलाई मात्रै। अनि एज आउटब्रेक प्रोग्रेसेस, जस्तै के छ भनेदेखि अघि राजुजीले भन्यो म्युटेसनको कुरो। एज आउटब्रेक प्रोग्रेसेस म्युटेसन इन आरएनए जिनोम हेज डिटेक्टेड। अहिलेसम्म 12,509 भाइरल जिनोमहरूलाई के छ भने सिक्वेन्स गर्यो र त्यसमध्ये 5,033 अमाइनो एसिड रिप्लेसमेन्टहरू डिटेक्टेड गरेको छ डिफ्रेन्ट भाइरसको डिफ्रेन्ट पोर्सनबाट। अब यसले कसरी काम गर्छ त? पहिलो कुरो त के छ भनेदेखि रिसेप्टर बाइन्डिङ मोटिभ अफ COVID-19 contains a main amino acid in viral yes protein. So यो फिगर देखिन्छ यहाँ, मैले चलाउँदाखेरि देखिहाल्छ हैन?
देखिन्छ।
यो भाइरसको यो प्रोटिन के गर्छ भनेदेखि यो ह्युमन सेल हो यहाँ र यो भाइरसको यो प्रोटिनले के गर्छ भनेदेखि यो प्रोटिन चाहिँ ह्युमनको ACE2 त्यसलाई चाहिँ के छ भनेदेखि एन्जियोटेन्सिन कन्भर्टिङ इन्जाइम 2 पनि भन्छ, त्यहाँ बाइन्ड गर्छ। बाइन्ड गरेपछि यो इन्डोसाइटोसिसबाट भाइरस भित्र छिर्छ। भाइरस भित्र छिरिसकेपछि यसको मेम्ब्रेन डिजल्भ हुन्छ र यसको ओपन रिडिङ फ्रेम आरएनए रिलिज हुन्छ र त्यो आरएनएलाई के गर्छ भनेदेखि हाम्रो सेलमा भएको मेकानिजमले चाहिँ प्रोटिन बनाउन सुरु गर्छ र प्रोटिन बनाइसकेपछि अनि फेरि एसेम्बल हुन्छ, आरएनए एसेम्बल हुन्छ र एसेम्बल भइसकेपछि एनएस र एम प्रोटिनहरू माइटोकन्ड्रियामा गएर बस्छ र यो अनिखेर अर्को के छ भनेदेखि भिरियोन बन्छ र यो एसेम्बल भइसकेपछि इक्जोसाइटोसिस भएर त्यसपछि त्यो भाइरस बाहिर आउँछ। यसै गरी फेरि यो भाइरसले अर्को सेललाई अट्याक गर्छ। अब यहाँ when the coronavirus find a suitable cell, so suitable cell भन्ने बित्तिकै के छ भनेदेखि मोस्टली रेस्पिरेटरी र बकल क्याभिटी र लङ्सको सेल्सलाई प्रायः जसो यसले एट्याक गर्छ। अनि इट इन्जेक्ट स्ट्रान्ड्स अफ आरएनए मल्टिप्लाई एन्ड कज डिजिज। अनि डिजिज ह्युमनमा पनि के छ भनेदेखि 3 थरीको स्टेजेस छ डिजिजको, स्टेज 1, स्टेज 2 र स्टेज 3। जुन हामी सुन्छौँ के छ भनेदेखि कोभिड भएको मानिसलाई भेन्टिलेटर चाहिन्छ, त भेन्टिलेटर चाहिँ प्रायः जस्तो स्टेज 3 मा गएपछि हुन्छ। आई एम नट गोइङ टु गो इन डिटेल अबाउट दिस डिजिज प्रोसेस, हाउ इट works in human. अब पोटेन्शियल ड्रग फर द ट्रिटमेन्ट अफ कोभिड के छन् त त्यसमा भन्दाखेरि अहिलेसम्म के छ भनेदेखि देयर आर नो फुड एन्ड ड्रग एडमिनिस्ट्रेसन एप्रुभ ड्रग फर द ट्रिटमेन्ट अफ कोभिड-19 अनि ट्रिटमेन्टको लागि NIH नेसनल इन्स्टिट्युट्स अफ हेल्थ has developed COVID-19 treatment guidelines. So based on that guidelines, there are three different major therapy. One is antiviral therapy, another one immune-based therapy, अर्को चाहिँ adjunctive therapy. And immune based therapy मा पनि blood derived products छ र अर्को चाहिँ के छ भनेदेखि immunomodulators छ. अब antiviral therapy मा चाहिँ first one राजुले अघि भन्नुभयो रेमडेसिभिर, त्यसपछि क्लोरोक्विन, हाइड्रोक्सीक्लोरोक्विन, लोपिभाभिर, अनि रिटोनाभिर, त्यस्तै के छ भनेदेखि कन्भेन्सनल प्लाज्मा ब्लड ड्राइभ प्रोडक्टमा इम्युनोग्लोबुलिन्स अनि मेसेन्काइमल स्टेम सेल्स, कर्टिकोस अनि इम्युनोमोडुलेटर्समा चाहिँ कर्टिकोस्टेरोइड्स, इन्टरफेरोन अल्फा एन्ड बीटा, इन्टरल्युकिन 1 इन्हिबिटर, इन्टरल्युकिन 6 अनि काइनेज इन्हिबिटर्सहरू छ. त्यस्तै एन्टी थ्रोम्बोटिक थेरापी, भाइटामिन C, D एन्ड जिङ्क सप्लिमेन्ट्सहरू छ. अब पोटेन्शियल ड्रगले कहाँ काम कसरी गर्ने त भन्दाखेरि there are several places where you can target virus. So one is either you target here in their membrane, spike protein ma, or virus भित्र छिरिसकेपछि maybe the membrane and RNA मा. त्यस्तै गरेर के छ भनेदेखि भाइरस जब एसेम्बली गर्छ शरीर सेल भित्र त्यो ठाउँमा र इभन के छ भनेदेखि एक्जोसाइटोसिस हुनभन्दा अगाडि भाइरस ननिस्कोस्, अरू सेललाई इन्फेक्ट नगरोस् भनेर. सो देयर आर several places where you can target different types of drugs. This is, a couple of my slides are very crowded, but I'm not going to go in detail, but I'm just going to give some basic information about this one. अब सबभन्दा पहिला त के छ भनेदेखि remdesivir, which is not approved yet, but it is the mechanism of action चाहिँ यसो के छ भनेदेखि it is a nucleotide prodrug of an adenosine analog binds to viral RNA and binds to viral RNA polymerase. The RNA polymerase मा bind गर्ने बित्तिकै के गर्छ भनेदेखि यसले फर्दर के छ भनेदेखि त्यसको प्रोटिनहरु बनाउन दिदैन. It has been studied in several clinical trials. र यसको बेनिफिट चाहिँ के छ भनेदेखि 5 दिनदेखि 10 दिन 5 दिन र 10 दिन ट्रिटमेन्ट गर्दाखेरि पनि खासै फरक देखिया छैन 10 दिनको लामो ट्रिटमेन्टमा. अनि पार्टिसिपेन्ट्स who received this drug, the recovery is within 11 to 15 days. Chloroquine सुरुमा आएको थियो यहाँ, which is approved for the malaria and extraintestinal amoebiasis. र यो ड्रग के छ भन्दाखेरि रिसेन्टली इन जुन 15 FDA ले रिभोक गर्यो फर द इमर्जेन्सी युजको लागि गरिया थियो, रिभोक गर्यो because there was a lot of fatality. 27% the fatality was 27.2% and then mortality was 39% after using this drug. त्यस्तै हाइड्रोक्सीक्लोरोक्विनको पनि सेम, यसको इफिकेसीहरु खासै केही पनि देखिएन, रादर यसले पनि के छ भनेदेखि अझ राम्रो गर्न भन्दा नराम्रै गर्यो. अनि अर्को के छ भने एचआईभी इन्फेक्सनको लागि एप्रुभ भएको ड्रगहरु लोपिभाभिर अनि रिटोनाभिरहरु चाहिँ छ. अलि सेभरल स्मल क्लिनिकल ट्रायल्सहरु गएको छ, तर के भइरहेछ, तर के छ भनेदेखि अलिअलि र्यान्डमाइज ट्रायल्सहरु चाहिँ के छ भनेदेखि फेल पनि भयो. त्यसैले गर्दाखेरि वी डोन्ट नो द फ्युचर अफ दिस ड्रग. अब सायद बिन्जनाजीले अलिकति डिटेलमा भन्नुहुन्छ होला यो कन्भल्सेन्ट प्लाज्माको बारेमा. कन्भल्सेन्ट प्लाज्मा चाहिँ कस्तो भनेदेखि जुन मानिसलाई कोभिड भएको छ र त्यसबाट के छ भनेदेखि प्लाज्मा निकालेर अनि बिरामी भएकोलाई दिने हो यो. र यसको चाहिँ वास्तवमा के छ भनेदेखि स्मल क्लिनिकल ट्रायल भएकोले यो अहिले रिसेन्टली लास्ट विक चाहिँ निकै कन्ट्रोभर्सियल पनि भयो अमेरिकामा यसलाई के छ भनेदेखि बन्द गर्ने कि नगर्ने भनेर तर हिजो अस्ति मात्रै एफडीएले फेरि इमर्जेन्सी ट्रायलको रूपमा चाहिँ युज गरे हुन्छ भनेर भन्यो त्यस्तै अरू के छ भनेदेखि स्पेसिफिक इन्ट्राभेनस इम्युनोग्लोबुलिनहरू छ यी सबै सानो ट्रायलहरू चाइनातिर त्यस्तै के छ भनेदेखि मिजेनकाइमल स्टेम सेल यो पनि के छ भनेदेखि 7वटा पेसेन्ट चाइनामा भएको छ त्यस्तै डेक्सामेथाजोन वी नो द डेक्सामेथाजोन इज भेरी ओल्ड ड्रग यो चाहिँ एलर्जी र अरू उसको लागि एप्रुभ भएको ड्रगहरू हो यिनीहरू के छ भनेदेखि मल्टी सेन्टर स्टडी युकेमा भइरहेछ त्यस्तै इन्टरफेरोन अल्फा र बीटाहरू ल्युकेमिया मेलानोमाहरूको लागि एप्रुभ भएको ड्रग हो त्यो पनि के छ भनेदेखि हङकङ र अन्ततिर के छ भनेदेखि युज भइरहेछ तर सबै के छ भनेदेखि अहिलेसम्म कुनै पनि प्रमिसिङ ड्रग चाहिँ वास्तवमा के छ भनेदेखि यो ड्रग लिनुस् कोभिड निको हुन्छ भन्ने चाहिँ अहिलेसम्म वास्तवमा कुनै पनि छैन त म अलिकति अर्को उसमा जाउँ त्यस्तै के छ भनेदेखि काइनेज इन्हिबिटर्सहरू छ त्यो क्लिनिकल बेनिफिट अहिलेसम्म वास्तवमा के छ भनेदेखि थाहा छैन काइनेज उसको भाइटामिन सी डी र यो जिङ्क सप्लिमेन्ट्सहरू चाहिँ यिनीहरू पनि दिइरहेछ यसले चाहिँ के छ भनेदेखि अलिकति इम्युन रेस्पोन्सहरूलाई अलिकति बिल्डअप गर्छ भनेर युज भइरहेको अब आउँ के छ भनेदेखि भ्याक्सिन डेभलपमेन्टमा के भइरहेछ त So what are the differences between traditional vaccine development versus a pandemic condition? So traditional vaccine development मा प्राय जसो के गरिन्छ भनेदेखि अब म चाहिँ वास्तवमा के छ भने भ्याक्सिन एक्सपर्ट होइन तर के छ भनेदेखि म ड्रग डेभलपमेन्टमा काम गर्दछु त्यसले गर्दाखेरि ड्रग डेभलपमेन्ट र भ्याक्सिन डेभलपमेन्टको अलमोस्ट उस्तै कुरो भएकोले अलिकति मैले यहाँ के भन्न चाहन्छु भनेदेखि कुनै पनि भ्याक्सिनहरू डेभलपमेन्ट गर्नुभन्दा अगाडि सबभन्दा पहिला के छ भनेदेखि इनभिट्रो स्टडिजहरू हुन्छ त्यसको मेकानिजमहरू अन्डरस्ट्यान्ड गरिन्छ त्यसपछि गएर एनिमल टेस्टहरू गरिन्छ र एनिमल टेस्ट भइसकेपछि फेज 1 क्लिनिकल ट्रायलमा जान्छ फेज 1 क्लिनिकल ट्रायलमा प्रायः जस्तो हेल्दी ह्युमन बिइङलाई दिइन्छ र हेल्दी ह्युमन बिइङलाई दिइसकेपछि सानो ट्रायल हुन्छ विभिन्न डोजहरू दिइन्छ त्यसको सेफ्टी र इफिकेसीहरू हेरिन्छ यसमा अनि त्यसपछि अलिकति ठुलो ट्रायलमा गइन्छ फेज 2 अनि त्यसपछि एकदमै ठुलो ट्रायलमा गइन्छ के छ भनेदेखि फेज 3 ट्रायलमा अनि फेज 3 ट्रायलमा गएर पनि कति भ्याक्सिन्सहरू र कति ड्रग्सहरू के छ भनेदेखि फेल भएका छन् र फेरि रिकल भएको छ र एप्रुभ भएका छैनन् र अनि त्यसपछि बल्ल के छ भनेदेखि मास प्रोडक्सन हुन्छ नर्मली के छ भनेदेखि 10 इयर्स र भन्दा र 10 वर्ष मिनिमम र 10 वर्ष भन्दाखेरि बढी लाग्छ अहिलेसम्म वास्तवमा सबभन्दा चाँडो भ्याक्सिन एप्रुभ भएको मैले बुझे आधारमा चाहिँ एचआइभीको हो जुन कि लगभग 5 वर्ष चान्चुन महिनामा 5 वर्ष जति लाग्यो त्यो एप्रुभ हुन अब आउटब्रेकको सिचुएसनमा के गरिन्छ त किन आउटब्रेकको सिचुएसन जहिले अहिले यो कोभिडको बेलामा के भइरहेछ त भन्दाखेरि प्रिक्लिनिकल टेस्टहरू एनिमल टेस्टहरू र फेज 1 टेस्टहरू सँगसँगै भइरहेछ र फेज 1 फेज 2 लाई पनि के छ भनेदेखि कम्बाइन गरेर गरिरहेछ त्यस्तै फेज 2 र फेज 3 लाई पनि कम्बाइन गरेर गरिरहेछ त यस्तो केसमा के भइरहेछ त कोभिडको केसमा भन्दाखेरि मोस्ट लाइकली द भ्याक्सिन विल बी रेडी विदिन 2 इयर्स or maybe not more than 3 years. अब कति किसिमका भ्याक्सिन छन् त अहिलेसम्म के छ भनेदेखि भ्याक्सिनको के छ भनेदेखि ट्रायल भइरहेछ त एउटा चाहिँ के छ भनेदेखि न्युक्लिक एसिड बेस्ड भ्याक्सिन जुन कि हामी न्युक्लिक एसिड भ्याक्सिन्स आर कम्पोज्ड अफ DNA or RNA sequences encoding the antigens अनि भाइरल भेक्टर भ्याक्सिन्सहरू त भाइरल भेक्टर भ्याक्सिन्सहरूमा चाहिँ के छ भनेदेखि अरूै भाइरसमा कोभिडको जिनहरू हालेर अनि इन्जेक्ट गर्ने अनि प्रोटिन बेस्ड भ्याक्सिनमा चाहिँ युज अफ प्रोटिन और प्रोटिन फ्र्यागमेन्ट टु प्रोभोक एन इम्युन रेस्पोन्स अनि होल भाइरस भ्याक्सिन्स अब होल भाइरस भ्याक्सिन्स भन्दाखेरि सायद हामीले मिजल्सको भयो वा के अरे स्मल पक्सको जुन हामीले भ्याक्सिन लिएका छौँ भनौँ न त्यो चाहिँ के छ भनेदेखि होल भाइरस हो विच इज एटेन्युएटेड अनि अर्को चाहिँ रिपर्पस भ्याक्सिन्स भनेको त भ्याक्सिन इज अलरेडी देयर तर के छ भनेदेखि वेदर द्याट विल वर्क इन दिस केस अर नट जस्तै के छ भनेदेखि अस्ट्रेलियामा टेस्ट भइरहेछ बिसिजी भ्याक्सिन बिसिजी भ्याक्सिनले कोभिडलाई सेभ गर्छ गर्दैन भनेर चाहिँ त्यो अस्ट्रेलियामा टेस्ट भइरहेछ अब अहिलेसम्म यो स्लाइड बनाइसकेपछि मैले यसो हेरेको थिएँ अहिलेसम्म देयर आर कतिवटा भ्याक्सिनहरू छ त अहिलेसम्म यो भ्याक्सिन रेसमा गइरहेका कम्पनीजहरू र कन्ट्रिजहरू अहिलेसम्म मोर देन यो अलिकति पुरानो स्लाइड पर्यो अहिले 170 भन्दा बढी प्रिक्लिनिकल ट्रायलमा छ त्यसमध्ये 18वटा भन्दा बढी फेज 1 क्लिनिकल ट्रायलमा छ 12वटा भन्दा बढी चाहिँ फेज 2 मा छ 6वटा फेज 3 मा छ र अघि राजुजीले भन्नुभयो दुईटा भ्याक्सिन एउटा त के छ भनेदेखि एप्रुभ भयो भनेर भन्छ एउटा चाहिँ के छ भनेदेखि चाइनामा आर्मी र अरू हेल्थ वर्कर्सहरूलाई दिइरहेछ भनेर भनिएको छ एप्रुभ भएको र अर्को चाहिँ रसियाले क्लेम गरिरहेछ र रसियाले क्लेम गरेको चाहिँ के छ भनेदेखि अहिलेसम्म मैले बुझे आधारमा इट वाज अलरेडी इन फेज 2 कम्प्लिट गरेर उनीहरूले फेज 3 लाई नै उनीहरूले के छ भनेदेखि अलरेडी भ्याक्सिन भनेर एप्रुभ गरेको गरे जस्तो छ दे आर डुइङ फेज 3 एज वेल एज भ्याक्सिन डेभलपमेन्ट टुगेदर जस्तो भइरहेछ त्यसको चाहिँ अब न्युक्लिक एसिड भ्याक्सिनमा चाहिँ अब जस्तो एमआरएनए मैले जस्तो यो के छ भनेदेखि टेबल बनाए एकदम क्राउडेड टेबल छ तर बिस्तारै म सबै त भन्दिनँ तर जस्तो न्युक्लिक एसिड भ्याक्सिनमा के भइरहेछ त एमआरएनए भ्याक्सिन फेज 3 भेरी अहिले वास्तवमा के छ भनेदेखि सायद एकदमै चाँडो आयो भनेदेखि मोडर्ना र पहिलोचोटि पब्लिक र प्राइभेट र पब्लिक के अरे प्राइभेट सेक्टर र गभर्मेन्ट सेक्टरले सँगै काम गरेर निकाल्न थालेको भ्याक्सिन चाहिँ मोडर्ना र नेसनल इन्स्टिट्युट अफ हेल्थले हो र जुलाई 27 मा अलरेडी दे लन्च्ड फेज 3 क्लिनिकल ट्रायल will enroll 30,000 healthy people at 89 sites in USA. त्यस्तै एमआरएनए अर्को भ्याक्सिन छ which is in phase 2 and 3 फाइजरले बनाइरहेछ त्यस्तै सेल्फ एम्प्लिफाइङ आरएनए भनेपछि शरीरमा दियो शरीरको अरू मेकानिजमले चाहिँ त्यो रेप्लिकेट गरिदिने अनि त्यो पनि भइरहेछ अर्को एमआरएनए भ्याक्सिन फेज 1 र 2 मा छ जुन कि जुलाई 21 मा सिङ्गापुरमा एप्रुभ भएको छ यो एप्रुभ भन्दाखेरि फेज 1 र 2 को लागि अर्को एमआरएनए भ्याक्सिन्सहरू छ त्यस्तै डिएनए भ्याक्सिन चाहिँ फेज 2 र 3 मा यो समरमा स्टार्ट हुँदैछ and there is another DNA vaccine phase 1 and 2 by Zydus and DNA vaccine. So these are the just list here. The Korean company is also involved in DNA vaccines. Viral vector vaccines भन्दाखेरि अब यो अर्को थरीको भ्याक्सिन हो जसमा कि चिम्पान्जी एडिनोभाइरसलाई भाइरसमा चाहिँ कोभिडको भाइरल जिन हालेर अनिखेर उ गर्ने यो चाहिँ एस्ट्राजेनिका र अक्सफोर्ड युनिभर्सिटीले गरिरहेछ र दिस इज अलरेडी इन फेज 2 and 3 ट्रायल इन इङ्ल्यान्ड एन्ड फेज 3 ट्रायल इन ब्राजिल एन्ड साउथ अफ्रिका एन्ड इमर्जेन्सी भ्याक्सिन मे डेलिभर अन अक्टोबर आई थिङ्क यहाँ यो अलिकति छेकियो होइन आई थिङ्क इट इज 2020 आई थिङ्क अनि जुन चाइनामा एप्रुभ भएको भ्याक्सिन जुन हामीले भन्यौँ त्यो एडिनो भाइरस AD5 भाइरस हो र यो चाहिँ CanSino Bio एन्ड चाइनिज एकाडेमी अफ मिलिट्री मेडिकल साइन्सले चाहिँ एप्रुभ गरेको र आर्मी र त्यहाँको हेल्थ वर्करहरूको लागि त्यस्तै अरू एडिनोभाइरस 5 जोन्सन एन्ड जोन्सनले गरिरहेछ त्यसपछि ग्लेमिया रिसर्च इन्स्टिट्युटहरू रसियाको भयो त्यसपछि विभिन्न संसारका विभिन्न के छ भनेदेखि कम्पनीज र विभिन्न देशहरूले विभिन्न किसिमको भ्याक्सिनहरू बनाइरहेछन् मिजल्स भाइरसहरू युज गरिरहेछ, एडिनो भाइरसहरू युज गरिरहेछ। त्यस्तै प्रोटिन बेस्ड भ्याक्सिनमा चाहिँ अघि नै मैले भने प्रोटिन अब कुनै फेज 2 मा छ, कुनै फेज 1, 2 मा छ। यिनीहरू आउन अझै हामीलाई के छ भनेदेखि धेरै नै समय लाग्छ। र अब प्रोटिन बेस्ड भ्याक्सिनमा चाहिँ इन्ट्रेस्टिङ अर्को के छ भनेदेखि प्रोडक्सन सजिलो हुन्छ र चाँडो हुन्छ भन्नको लागि चाहिँ कुनै कुनै भाइरल प्रोटिन चाहिँ टोब्याको प्लान्टमा के छ एक्सप्रेस गरेर अनि त्यहाँबाट एक्सट्र्याक्ट गरेर अनि के ह्युमनमा दिने। त्यस्तै अर्को भाइरल प्रोटिन छ जुन के सानोफी र जिएसकेले स्टार्ट गर्न खोजिरहेको, त्यो चाहिँ अहिले प्रिक्लिनिकल फेजमै छ। त्यो प्रोटिन विल बी प्रोड्युस इन इन्सेक्ट। अनि होल भाइरस भ्याक्सिनहरू पनि के छ भनेदेखि आइरहेछ। जस्तै फेज 3 मा गइरहेछ एउटा यो चाइनिज सिनोफार्मा चाइनिज कम्पनी हो। यो जुलाई 20 मा उनीहरूले फेज 3 ट्रायलमा लन्च गर्यो। अनि त्यसपछि इन्फेक्टिभ भाइरसहरू छ। अनि यो विभिन्न के छ भनेदेखि फेज 2 फेज 3। त मोस्ट के छ भनेदेखि जुन फेज 3 मा गएको छ त्यो चाहिँ मोस्ट लाइकली विल गेट इट सुन। अनि अर्को चाहिँ के छ भनेदेखि रिपर्पस्ड भ्याक्सिन जुन म अघि नै मैले भने बीसीजी भ्याक्सिन। यो चाहिँ के छ भनेदेखि बीसीजी भ्याक्सिनले वेदर इट विल सपोर्ट इम्युन सिस्टम टु प्रिभेन्ट कोभिड अर नट भन्ने कुरो चाहिँ के छ भनेदेखि अस्ट्रेलियामा यो टेस्ट भइरहेछ। सो अन्तिममा के छ भनेदेखि यो पुरैलाई समराइज गर्दाखेरि COVID-19 एज we all know that it is very complicated viral disease, and when the virus finds a suitable cell, it injects strands of RNA, multiplies and causes disease, and no approved drugs for the treatment. However, Remdesivir showed the promising result when compared to other drugs, and there is a race for vaccine development all over the world. झन्डै 150 वटा देशहरू अहिले के छ भनेदेखि भ्याक्सिन डेभलपमेन्टको रेसमा छन्। र रिसेन्टली के छ भनेदेखि मोडर्नाले एउटा जुलाई 27 मा प्रेस रिलिज गर्यो र यो चाहिँ के छ भनेदेखि यो भ्याक्सिन चाहिँ बिगिनिङ अफ 2021 मा एभाइलेबल हुन सक्छ भनेर भनेको छ। यति भन्दै I'll finish my talk here. Thank you, Rajuji, Dronaji, Manoji, and everybody, and all the listeners.
Thank you, Dr. Saab. It's an very insightful presentation on the vaccine development and the confusion everyone has. I think this would have definitely helped understand the perspective of it. Before I invite our next speaker, Bimjana Jilai, I would like to share a slides which I couldn't show earlier. This is a slide. This is a message come out in Australian Prime television 7 news yesterday about a vaccine, BCG vaccine, as the repurposed vaccine which we are developing here in collaboration with the University of Queensland and CSIRO, where I work, the organization which is very famous for doing vaccine work. So Rupakji, can you play that slide, this slide, please? Can you see and hear?
Can't hear, but we can see.
Yeah, we can see.
Rupak, can you fix the sound?
Vaccine would work and when we might get it.
Hi, Raja, voice.
This is the homegrown liquid that could save millions of lives. Australia's contender in a race that sent scientists and superpowers
scrambling. Through Operation Warp Speed, we will deliver a vaccine in record-breaking time. We're doing very well on the vaccines.
Russia claims to have created the world's first vaccine. It's called Sputnik 5.
Globally, more than 160 potential vaccines are being developed. 29 of those have reached human trial stage. On that list is Australia's candidate from the University of Queensland with help from other agencies, including this team at the CSIRO's Clayton Lab. Effectively, UQ came up with the recipe, CSIRO cooked up a big batch.
We've had to do incredibly long hours, and people have just stepped up.
Like nothing we've seen before. What traditionally would have taken 10 years has happened in a matter of months.
Known as the molecular clamp vaccine, so far it's been tested on 120 volunteers with results due next month. That's phase 1, checking it's safe. Phase 2 is injecting hundreds more people to see that it actually works, while the third and final phase involves testing on thousands to confirm effectiveness. Other bids may be further advanced, but we're in the game.
We're not better or worse than the rest of the world. It's one candidate in a large pool.
Local scientists have also played an important role with the much talked about Oxford candidate. It was first tested on ferrets at this CSIRO lab in Geelong. If the Oxford vaccine is approved before Australia's, we'll take the British formula and make our own. Whichever wins that race, the vaccine we take will likely be produced at CSL in Melbourne.
A vaccine for every single Australian with the vaccines manufactured right here in Australia?
Very difficult question, but what's your best prediction for when people will actually be able to receive a vaccine?
It's impossible to predict a time frame for when the first effective vaccine, because we don't know at this stage whether any of the candidate vaccines will be effective or not. What we can predict is that the first vaccines will finish clinical trial by the end of this year, and by then we will know whether they're effective. If they're effective, we will be able to get them into people next year.
Experts say we'll probably need to take that vaccine every year, and it'll act as a cure rather than a one-shot prevention.
Will work in a similar manner to the flu vaccine, in that it will lessen the severity of the virus and it will also shorten the duration that you have the virus. That is opposed to, say, a measles vaccine where it prevents you getting the virus.
The team at CSIRO is excited to be part of what is hopefully a once-in-a-lifetime mission and the opportunity to use their skills and all this equipment. But scientists worldwide are also realistic. It is rare to develop a successful vaccine, and it's never been done in this shorter time frame.
80% of vaccines fail. So in all probability, 80% of those 150 to 200 will fail.
But the scientific community is confident they will crack the code, because for perhaps the first time in history, the world's most brilliant minds, including these Australians, are working together.
Because we've got an actual humanitarian crisis on our hands.
Good
That
luck,
is fascinating,
everyone.
isn't it?
Thank you, Rupak Bhai. Thanks. I think it was very good to show these slides after Dr. Dineshji's presentation, Pachi, which is very well summarized. And Dornaji, tapainle ta yo lab visit pani garnu bhate when you were in Australia, actually in CSR.
Yeah, I do remember.
Yeah, you do remember. So anyway, I think it was excellent presentation, Dr. Again, thank you very much. We'll have more person coming to you from the audience and within the panel. So without delay, I'd like to welcome Bimjana ji to give her presentation. Bimjana ji, you're welcome now.
Namaste. Thank you for having me here today. And thank you, NRN and NSFT, for such an informative program on current pandemic situation. And Dr. Gautam, it was really informative. I really learned a lot about vaccines today, actually. And I guess we had a kind of a communication error a little bit, so I will be building up on Dr. Gautam's slides. Sort of, there's going to be a lot of redundant information, but I'll try to go faster and kind of focus more on the immunological aspect. I'm going to share my screen. Why couldn't I share my screen? Okay, hold on 1 second.
Let me know, otherwise I can say for you.
Actually, I made some changes just now.
Okay.
Yeah, you are co-host, you could share.
Okay.
If you go at the bottom of
Why
the
is it
screen,
not showing my, yeah, so I have my PowerPoint open.
yeah, if you go click the button share screen,
Okay.
at the at the bottom of this, yeah, now
Okay,
we
got
can
it.
see. Yeah,
Can you see? Yeah, okay.
yeah, we can see now.
So basically,
Make it full screen.
Put it to full screen, yeah, screen mode. Yeah,
yep.
thanks.
So again, Dr. Gautam already went through the virus's history and what exactly it is. The point to drive home here, I want to focus on one thing, is that virus in itself is not a living thing. It's just like it's a nucleic, it has a nucleic acid genome and enclosed in a protein code. It's just a pathogen or infectious agent, if you will. And so it needs a host body and a living cell in the host body for replication. So there are currently 4 human viruses, coronaviruses, and 3 of them are the most recent one, the SARS one, which is the one that currently we're facing is from the SARS-CoV-2. It's the mutated version of the SARS-CoV, which was emerged in 2003, and these are the genotic ones. That means can be transmitted from animals to human. So basically, it's the same as that. I'm just going to kind of quickly gloss over it. And because this is the newest mutated virus, so our immune system has never seen it before. That's why it's getting so difficult to fight with it. So how does the virus, gets into the host body and replicates? The key takeaway here is that it enters the body generally through mouth or nose. On the cells, it binds to the ACE2 receptor, like Dr. Gautam already told. And then it gets endocytosis, get in there, and then it hijacks the ribosomes, make more RNAs, and make more proteins. The envelope proteins, it get assembled and then exit out of the cells and get into more other cells, get attack more cells. Here, I just added this quick slide for the immune response. So how does our immune system sees it? Once the infection happens, our innate immune system kicks in, is the first line of defense. This dendritic cells so first, let's say, recognize let's say uptake viral antigen, and it presents through MSC genes. I don't want to go too much detail into the immunology, but it goes and present it to T cell, and then T cell will signal to B cells to make the antibodies. So in the plasma cells, the antibody is made, and this is the adaptive immunity. So it will take some time, like a couple of weeks. That's when all this cytokine is produced, and there's inflammation, and all the virus killing begins. And also, besides this, we also have a T cell, memory T cell, and memory B cell. So when we see this virus again, next time go expose our then it will recognize, oh, this is the same virus, and then it kicks in, and then it start making more antibodies. So let me, sorry, can you still see it?
Yeah, we can see.
So okay, here, how does the COVID happens? What exactly is COVID? How is the pneumonia happens? Basically, COVID is like, it's pneumonia and other multi-organ failures, right? How does that happen? Once inside the body, it gets into pneumocytes, which have very high number of the ACE receptors. The pneumocyte lines the air sacs or alveoli in our lungs. And you take the microcilium, so gas exchange ko lagi, it supplies oxygen to our bloodstream, and that's where it gets replicated. As it multiplies, immune response is triggered as the host body defends, and then the cytokines are released. Cytokines, they are the regulatory protein, or it mediates the innate and adaptive immunity, and it triggers inflammation as a natural response to infection. As this process unfolds, fluid begins to accumulate in the alveoli. Can you see my pointer also?
Yep.
That's when we start seeing dry cough, and it makes the breathing difficult. When there's this virus overload, when this immune system activates too much and there's like hyperactivity, then it's start releasing a lot of cytokines. So that's what is termed as cytokine storm, which can damage the lungs and can cause respiratory distress. At this stage, there is like surfactants in the alveoli, which holds their structure. So once it's filled with fluid, which is all the leukocytes and all the immune cells and the debris, containing. So then it starts collapsing, and this is when we have so much difficulty, difficulty breathing, and it's then the pneumonia starts because it is a lot of fluid built up in there. And there will be multi-organ failure if this seeps out from the alveoli and goes into the bloodstream. It's become the sepsis, and then there will be multi-organ failure, and it could be fatal. So who are at the high risk category are the elderlies and the people who have immune compromised people with like pre-existing disease like diabetes and high blood pressures. Actually, high blood pressure is a kind of a little bit of a controversial issue, and I can touch upon that in a minute or not, because it's basically for diabetes also, people who are in blood pressure, who has blood pressure can something's wrong with my camera. They take ACE inhibitors. So there is some studies, but it's still controversial. It's not very अहिलेसम्म completely त्यो स्टडीलाई त्यसको कुनै फ्याक्ट छैन. कपल अफ स्टडिज मात्रै छ, त्यसलाई कुनै चाहिँ एकदमै मानेर हिँड्न सकिँदैन कि एस इनिबिटर युज गरेछ भने कोभिडको कम्प्लिकेसन्स कुड बी लेस, बिकज किनभने त्यो रिसेप्टरै खाली भएन भने त्यहाँ उसले स्पाइक प्रोटिन्सले गएर अट्याच गर्न पाएन, त्यसले गर्दा भाइरल एन्ट्री हुन पाएन भन्ने हिसाबले. So these are some of the clinical features, which as simple as like fever, dry cough, or fatigue, to uncommon symptoms, and the severe ones like multi-organ failure and pneumonia. So what are the modes of transmission? So there are direct and indirect contacts. Direct contact मा चाहिँ saliva, खोक्दाखेरि respiratory secretion droplets, and indirectly चाहिँ aerosols र fomites. Fomites भन्नाले चाहिँ जुन चाहिँ aerosolize हुन्छ हावासँग मिक्स भएर त्यो लिक्विड ड्रपलेट्स, अनि भुइँमा खसेकोहरूलाई चाहिँ त्यो खसेको ठाउँमा गएर छोएछ भने त्यो पनि इन्फेक्सन हुने चाहिँ डर हुन्छ. यसको भायबिलिटी चाहिँ भन्नाले कति बेलासम्म it's gonna stay on the surface is like from hours in aerosols up to days in the fomites or the surfaces. यसको ROI भनेको rate of infection around 3 छ. So every person can make 3 other person infected, and 3 personले 9 person infected गर्छ. So 3 times को फोल्डमा गइरहेको हुन्छ. So मलाई एकदम मन परेछ यो डाइरेक्टर जनरल WHO को डाइरेक्टर जनरलले भन्नुभएको कि there is no silver bullet at this moment, and there might never be. But having said that, there's a lot of rays of hope. Dr. Gautam already touched upon this. There are several vaccine candidates that have entered the late stage clinical trials. So he talked about all the vaccines in the pipeline. So the latest being the Novavax from Novavax company. I forgot the company's name, but it's a Novavax. It stops the replications in the upper respiratory tract, so which is really good. So that news came out like maybe August 4th. And then there are several drugs that are being repurposed, just the broad spectrum endocytosis inhibitors like chloroquine, antivirals, remdesivir, and viral protease inhibitor, सबैले चाहिँ viral replication. So just to kind of reiterate the same thing that Dr. Gautam was saying. And then there are immunomodulators, which can curb the cytokine storms. Just जुन चाहिँ अब त्यही host response भयो, rampant virus replication भएपछि host response को रूपमा हुने cytokine stormले चाहिँ. अनि अर्को चाहिँ innate immunity enhancers like IFN gamma, यिनीहरू चाहिँ innately fight गर्नलाई help गर्छ. So exogenously दिने भनौँ न. Of convalescent plasma चाहिँ this past Sunday it has been approved very quickly and briefly. There are a lot of controversy around it, in a sense that अहिले ready छ कि छैन भन्ने विषयमा. In theory it should work perfectly. जुन स्लाइड मैले पहिला देखाएँ जसरी पहिला चाहिँ innate immunity as a first line defense fight गर्छ, अनि दोस्रो चाहिँ त्यो adaptive immunity kick in हुन्छ. त्यो हिसाबले convalescent plasma it's something like जुन मान्छेलाई पहिल्यै चाहिँ भइसकेको छ, डिजिज भइसकेको छ, कोभिड भइसकेको छ भने their blood should have those antibody made in them. So त्यही प्लाज्मालाई निकालेर यदि चाहिँ अर्को पेशेन्टलाई दिने हो भने that should work as like to restart their immune system, the other person's immune system like चाहिँ kind of boost गर्ने जस्तो गरेर एक किसिमले. अनि अर्को इस्यु चाहिँ छ अब herd immunity. Herd immunity जब एकदमै large population portion of the community immune भएपछि मात्रै हुन सक्छ. त्यसको लागि चाहिँ धेरै जसो मान्छेलाई infection भइसकेको हुनुपर्छ or vaccine हुनुपर्छ. But like we said, the vaccine would be ready perhaps in the middle of next year or early next year. Like Moderna said, it will be early next year. And so we are very hopeful of that. So in the meantime, अब यो भ्याक्सिन नआउन्जेल गर्ने के त हैन अब हामीले कसरी यसलाई कर्ब गर्न सक्छौँ यो करेन्ट प्रिभेन्टेटिभ स्ट्रेटेजिज के हो त मेनली त एज सिम्पल एज ह्यान्ड हाइजिन अनि लाइक अनि डर्टी ह्यान्डले चाहिँ अब त्यो ह्यान्ड हाइजिनमा डर्टी ह्यान्डले चाहिँ डिफ्रेन्ट फ्रम टचिङ यर आइज नोज एन्ड माउथ किनभने त्यो लाइनिङहरूमा इपिथेलियल सेल लाइन्सले गर्दाखेरि त्यहाँ धेरै एज लाइक एस रिसेप्टर्सहरू हुन्छ त्यो कारणले नाक मुखमा नछुने भन्ने भयो अनि we need to adhere to the rules of social or rather say physical distancing like crowdsहरू mass gatheringहरू avoid गर्ने and 6 feet at least maintain गर्ने or face mask लगाउने I'm going to go a little bit deeper on this as I discussed with Dr. Rasali. So we wanted to discuss a little bit about this. So how does masks reduce airborne transmission? You know, of a symptomatic or asymptomatic infected individual, they can release this aerosol particle, like I earlier said, during breathing and speaking and even coughing. But masking China when it's a maximum exposure on bio, whereas universal masking result in the least exposure. Hand washing hand washing is very crucial because it stops the viral entry into the body. कसरी हुन्छ यसको प्रपोज मेकानिजम भने सोप मोलिक्युल्समा यस्तो हाइड्रोफिलिक हेड हुन्छ हाइड्रोफिलिक भने वाटर लभिङ द्याट मिन्स इट्स र चाहिँ यसको टेल चाहिँ हाइड्रोफोबिक हुन्छ नट वाटर लभिङ अब किनकि कोरोना भाइरसको यो जुन सर्फेस छ यो लिपिड बाइलेयर हो लिपिड बाइलेयर भएको भएर त्यो तैलिए भयो नि ओइली काइन्ड अफ थिङ भयो अनि यसको जुन हाइड्रोफोबिक टेल छ जुन कि लिपोफिलिक चाहिँ तेलले चाहिँ गएर उसलाई एट्याक गर्न थाल्छ त्यसले गर्दाखेरि उसले चाहिँ अब त्यो यसको के भन्छ यसलाई चाहिँ कम्प्रोमाइज गरे यसको ब्यारियरलाई कम्प्रोमाइज गर्यो अनि त्यसपछि निस्केपछि इट विल फर्म लाइक लिटल माइसेल्स एन्ड देन इट विल बी यु नो वास्ड अफ इन द वाटर ओके बट हात त धुने हैन तर हाउ एन्ड हाउ अफन एन्ड फर हाउ लङ सो सकेसम्म जति बाहिर गएर आएपछि या केही सामान टच गरेपछि बाहिरको सामान टच गरेपछि हात धुने र एटलिस्ट इट विल टेक 20 सेकेन्ड टु सेट दिस इन मोसन कि यो यसले चाहिँ यसको चाहिँ यसले ब्रेक डाउन गर्नलाई यसको लिपिड बाइलेयरलाई ब्रेक डाउन गर्नलाई एटलिस्ट 20 सेकेन्ड्स सुड बी 20 सेकेन्ड्स सुड बी रिक्वायर्ड लाइक त्यति चाहिँ गर्नुपर्छ अब हात धुनलाई पनि यसो गर्ने जस्तै अब एकदमै पाम टु पाम होइन ब्याक अफ द ह्यान्ड्स इन बिट्विन द फिङ्गर्स अब यसरी पुरा राम्रोसँग वास गर्ने है अब चाहिँ अनि ह्यान्ड सेनिटाइजर वर्क इन द सिमिलर वे किनभने त्यसले पनि चाहिँ लिपिड बाइलेयरलाई लाइसिस गर्छ लिपिड मेम्ब्रेन लाइसिस गर्ने भएको भएर इट सुड हेभ एटलिस्ट 60% अल्कोहल अब सबैभन्दा बेस्ट डिफेन्स चाहिँ सोसियल डिस्टेन्सिङ नै हो है किनभने यसले चाहिँ भाइरसलाई होस्ट बडीबाटै डिप्राइभ गर्ने भएको भएर लाइक वी स अर्लियर कि होस्ट बडी नै चाहिन्छ भाइरसलाई किनकि भाइरस आफैमा लिभिङ थिङ त होइन so it needs the host body so it deprives virus of this host body so social distancing is very crucial at this point social distancing is not really being socially isolated but physically isolated from another person you could still go out meet people but stay far enough to not have those droplets and fomites and the aerosols get into you kind of अनि छ भने मास्क लगाउने त्यो गर्न सकिन्छ जस्तै I really like this this was a video but for some reason it couldn't play here so I put a photo here I really like this because the fire भइरहेछ भने एउटा मात्रै पनि यो म्याच को सलाइको काँटी पछाडि आछ भने त्यो फैलेन नि त अब in the similar fashion social distancing is a very very important step I think so we discussed earlier I also wanted to see I see a lot of people even here हामी त ल्याबमा काम गर्छौं so we are very used to wearing gloves and we're very used to wearing the masks है म भाइरससँग पनि काम गर्छु एन्टिभाइरल्स अनि त्यही भएर मैले त मास्क डबल ग्लोभ डबल कोट सबै गर्छौं तर बाहिर मान्छेहरूलाई यसको विषयमा धेरै नै बताएको नभएर होला या चाहिँ आई डोन्ट नो आई सी अ लट अफ पिपल आर डुइङ दिस दे वेयरिङ इट एन्ड व्हेन दे ओपन दे आर टचिङ एभ्रीवेयर लाइक दिस द्याट्स नट अ प्रपर वे टु वेयर इट सो यसैले मैले के चाहन्छु भने यो प्रपर वे पनि एकचोटि देखाइहालौँ भनेर सो यु पिक अप बाई हियर पुट अन योर नोज on chasma लगाउनु हुन्छ भने you can just kind of do this so your chasma doesn't get fogged and then when you want to take it off you just take by the string here and this अनि फेरि मास्कै चाहिन्छ भन्ने पनि हैन हुन त सलहरुले पनि जस्तै सलहरु पनि लगाउन सकिन्छ हैन सबैसँग मास्कै किन्ने भन्ने पैसा पनि हुँदैन होला के चाहिँ यस्तै हाम्रो अब जस्तो नेपालको कन्टेक्स्टमा त्यस्तो कन्डिसनमा चाहिँ यु कुड वेयर स्कार्फ्स अर सल्स or even like a not disposable mask but cloth mask जसलाई वास गरिरहन सकोस् अब म त्यस्तै गरेर पन्जा पनि त्यो के भन्छ ग्लोभ्स पनि लगाउन देखाउँछु एकचोटि किनभने यो यसमा यो चाहिँ सबैभन्दा मेजर मैले प्रब्लम देखेँ ग्रोसरी स्टोरमा यहाँ चाहिँ इट्स म्यान्डेटरी टु वेयर like mandatory होइन mandatory for the mask but a lot of people I see wear gloves but they are touching everything with this hand and I think they are invincible just because they are wearing gloves so they are like then touching them with like this hand opening them and then doing like this or that so that's not a correct way to do it यदि तपाईले ग्लोभ लाउनै भएको छ भने you wear your gloves अब लाउँदाखेरि चाहिँ क्लिन भयो नि so you do your whatever you're doing and then when you're trying to take it off you go pinch it here मेरो क्यामेरा देखिरहनु भएको छ I couldn't see myself so and you open it like this
we are seeing it is
okay so you open it like this so now this is a clean portion because it was inside your hand and then you go from here like this you just kind of bent it from the top of your wrist and then you throw it now this is a clean part so you could throw it and then you wash your hand because this was the inner part right so thought that would be helpful. So in the meantime, we can also do some preventative medicine, like taking care of your body, your immune system, and your mental health. You know, you can still be active even when you're social distancing. Like, COVID-19 has derailed most people's normal exercise routines, right? But it's very important to stay on track, especially for your mental health and especially in regards to your underlying conditions. Exercise can reduce stress, keep your underlying disease like, blood sugar and BP in check, aids in sleep, and boost your immune system, which is very crucial, which can prevent serious complications of COVID-19. So get some sunlight and fresh air, all the while, of course, adhering to the, mitigation strategies that are in place and finding non-crowded place and timing, etc. जस्तै यहाँ चाहिँ हाम्रो एक्ज्याक्टली लकडाउन भनेर छैन म्यासाचुसेट्समा इट्स भेरी लो रेट राइट नाउ वी डोन्ट ह्याभ अ लकडाउन पर से बट वी हेभ सोसियल डिस्टेन्सिङ इन अ सेन्स कि मान्छेले अब एकदम मान्छेहरू पनि अवेर छन् वेयर ग्लोभ्स अर मास्क वेन एभर यु सी लट अफ पिपल वी डोन्ट नर्मली गो टु मास ग्यादरिङ्स एनीवेज अनि छ मान्छेहरू छ भने चाहिँ मास्क लगाएर हिँड्यो अनि सकेसम्म टाढा टाढा बस्यो त्यो अफोर्ड गर्न सकिन्छ भने त्यो गर्ने र बाहिर एक्सर्साइज गर्न जानुपर्छ भने अलग अलग टाइमिङमा जाने लाइक अलिकति ढिलो टाइम अरू जब मान्छे आउँदैन जब मान्छे छैन त्यस्तो गरेर गर्न सकिन्छ अर इभन माथि घरको छतमाथि गएर एक्सर्साइज गर्न सकिन्छ सनलाइट इज भेरी भेरी क्रुसियल भाइटामिन डी र कोभिडको कम्प्लिकेसन्स हेज लट अफ स्टडिज सो देयर लिङ्केज सो भाइटामिन डी इज भेरी भेरी इम्पोर्टेन्ट and get plenty of sleep, eat immune boosting foods like anti-inflammatory food. We saw that inflammation is all about it, right? And anti-inflammatory food is good for everything else, not just for this particular instance. अनि प्रोडक्टिभ हुने अब सोसियल डिस्टेन्स लकडाउनमा चाहिँ खालि सिनेमा मात्रै हेरेर बस्ने भन्दा पनि जस्ट बी प्रोडक्टिभ द्याट विल मेक यु फिल बेटर अबाउट समथिङ अनि आफूले पनि केही हासिल गरिन्छ र मेन्टल हेल्थलाई पनि किप्स द्याट इन चेक अनि आफूले रिच आउट टु फ्रेन्ड्स एन्ड रिलेटिभ्स हु आर अलोन लोनली एल्डरलिजहरू मोस्टली अलोन हुन्छ घरमा बसेको हुन्छ भने फोन गर्ने कुरा गर्ने जस्ट डोन्ट गेट कनेक्टेड टु यर फोन अल द टाइम गेट कनेक्टेड विथ पिपल इज वाट आई अलवेज से बिकज वी आर एज ह्युमन्स विथ थ्राइभ अन सोसियल वार्मथ So, Dr.
Binjanaji, you got few minutes.
Yeah, I'm on the last of my slides. So we also talked about infodemics. It was already raised in previous episode by Dr. Rasali. What is infodemics? It's like we are always inundated with this unfiltered information regarding coronavirus. So it's like waging a dual war against the pandemic and infodemic. So त्यसको extenuation framework के हुन सक्छ भने there has to be a multidisciplinary cooperation. जसले चाहिँ एउटा चाहिँ इन्फोडेमिकको लागि इफेक्टिभ रेस्पोन्स चाहिँ त्यो हुन्छ अर्को चाहिँ यो जुन जति पनि इन्फर्मेसन्स मेसेजेसहरू छन् द्याट मस्ट बी साइन्स एन्ड एभिडेन्स बेस्ड एन्ड सुड बी एक्सेसिबल टु अल सेक्टर्स अफ अल सोसाइटिज अनि मान्छेहरूमा चाहिँ अब हेल्थ एजुकेसन र हेल्थ लिट्रेसी हुनु पर्यो अनि एक्युरेट इन्फर्मेसनलाई चाहिँ कसरी टेलर गर्न सक्नु पर्यो गभर्मेन्टले भने डिफ्रेन्ट कल्चर्स ल्याङ्ग्वेजेस र लिट्रेसी क्यापेसिटी हेरेर त्यसलाई चाहिँ डिसिमिनेट गर्न सक्नु पर्यो है अनि पब्लिकले चाहिँ अब हेल्थ अथोरिटी र अरू रेलेभेन्ट अथोरिटिजमाथि ट्रस्ट गर्न सक्नु पर्यो फर द्याट वी निड ट्रान्सपरेन्सी फ्रम सच हेल्थ पब्लिक हेल्थ एजेन्सिज त्यसको लागि अब फेरि अर्को स्ट्रेटेजिक पार्टनरसिप हुनु पर्यो सोसियल मिडिया र टेक्नोलोजी प्लेटफर्म्स र चाहिँ स्टेक होल्डर्सको बिचमा जस्तै एकाडेमिया मेडिकल फिल्ड र रिसर्चहरूको र मान्छेहरूले पनि अनि सोसियल रेस्पोन्सिबिलिटी निभाउनु पर्यो रिगार्डिङ इन्फोडेमिक्स जे मनलाई त्यही सेयर गर्ने पर्पिचुएट गर्ने होइन पहिला तिनीहरूको अथेन्टिसिटी चेक गरेर अनि गर्ने भन्नु पर्यो so this is up for discussion in context of Nepal. What could we do? Like population level measure ma physical social distancing भयो soap भयो cloth mask भयो होइन प्रिकसनरी मेजर्सहरू लिन सकिन्छ भने त्यसरी गभर्मेन्ट लेभलमा पनि फाइनेन्सियल एसिस्टेन्सहरू दिन सक्नु पर्यो मान्छे हेल्थ वर्करहरूलाई चाहिँ सपोर्ट गर्न सक्नु पर्यो र रिलिफ मेजरहरू चाहिँ स्पिडी हुनु पर्यो I think I'm going to stop here and we can discuss more about this as a panel.
Yeah, thank you, Bimjanaji, for your excellent presentation. As I said before, like there are many questions will be coming to the panel. We'll have plenty of time to interact and reply to those questions again. So without much of a delay, I'd like to invite my colleague, my friend, Dona Rasaliji, to continue his leftover from the first episode, some of the messages which he wanted to continue. And here is the forum for you, and you have strictly 10 minutes or before. If you can finish, that'll be good. Thanks.
Okay, thank you, Dr. Raju Adhikari, and it was really great to hear Dr. Dinesh Gautam's deliberation, authentic and very informative, science-based research. He is a first-hand information from FDA. Not only FDA, he has a very rich background of molecular biology. He did masters in molecular biology. He comes from a doctor of veterinary medicine background like me myself, and he did his PhD in molecular biology, and he moved to United States in NIH. Several years he worked there as a researcher, and finally he landed in FDA. So in that path, he has a lot of knowledge in his head, and he summarized excellently to present his deliberation so clearly and very completely. And Bimjana ji, again, young scientist, she did wonderful job of summing up from molecular biology to the really practice, what goes on in everyday life. That's not something everyone can do. She did wonderful job. Thank you both for your wonderful contribution to this forum. We started this series of webinar to bring science-based, evidence-based information so as to manage the infodemics. That was the whole purpose, and you had really contributed very much. Thank you very much. In my presentation, I wanted to link up a little bit of what you have presented and give a little bit of what I have been associated with. I work in BC Center for Disease Control, which is the provincial headquarters for public health and managing COVID pandemic like COVID now. We work directly under the guidance of provincial health officers. Just like Dr. Gautam, I also have the disclaimer that when I speak here, I don't represent my organization. It's my voluntary contribution to the motherland, Nepal. That's what we have been doing as a diaspora people associated with some of the work that goes on here. Primarily, I'm on day-to-day in day job. I don't work directly on COVID virus as such. My area is chronic disease epidemiology. I'm director of population health surveillance and epidemiology at the center, which is a provincial health services authority, part of it. And also it is University of British Columbia's affiliated institution. That's where I work. I will share my slide. I don't have very many slides, just to give a talking point. I would like to share this. Can you see this slide?
Yes.
But I need to go to presentation mode.
Yep.
Here you go.
Yep.
Yeah, a few words about drugs and vaccine. We heard vaccine development, drug development from very knowledgeable people, both Dr. Dinesh Gautam and Bimjana Vishwakarma. I want to link up a little bit on that. That's what I want to do. basically unprecedented universal crisis of mankind. That's what COVID pandemic is. It has never been of this magnitude, affecting billions of people. Even in a century ago, when there was a pandemic, it was not like this. So it is such a humongous crisis that we have in front of us. We are facing them. In that, what it is all treatments, including physician fee, prescription drugs, and equipment, hospitalization, all should be made available to any human being diagnosed with COVID-19 with universal coverage. Wherever there are no universal coverage, I think that should be the case, because the vaccine or drugs, they are very expensive in a very short period of time. With a crash program of development of vaccine, there is millions of dollars to spend. But if countries like low-income countries like Nepal, Nepalese people are deprived of the facilities they need, all the expenditure of medical bills, it would be really horrendous. It should be, all the states should be joining hands, and they should be working to make this universal coverage for every human being. That's what is my thought I wanted to put forward. And on that course, I want to just not mention all the names of vaccines, antiviral or other treatments. Only I want to touch on some of the aspects here. Scientists around the world are working on finding potential drugs for treatments. There are vaccine projects. Already our experts have mentioned about Moderna, Innovio, Oxford University, Queensland University, and other pharmaceutical companies. And antiviral drugs. These are some of these names our experts already dealt. I don't want to go into details. There are other treatments like monoclonal antibodies, convalescent plasma, as both the experts mentioned about. There are immune modulator, stem cells, and hydroxychloroquine, things like that. And there are certainly supportive therapy like corticosteroids, natural Ayurvedic medicines. There are lots of them coming out. Some of those have some value in two ways. One way is to boost the general immunity of the body. Another is counteracting against the symptoms that the COVID patients exhibit. For example, if there is pneumonia, there is a lot of exudate in the lung alveoli, then that needs to be removed. Maybe corticosteroid like dexamethasone might be helpful. So some of these should not be confused with the curative disease. They are supportive ones. And talking about the vaccine development in depth, Dr. Dinesh Gautam elaborated very much. I just want to bring out one thing, as I said earlier, about the universality of the access of vaccines and drugs. What's happening in the world around is now China and Russia, they have come up with the first vaccines. They're already using in certain vulnerable patient group. And when they produce the mass vaccine, these two large countries will be also providing a lot of support to the low-income countries. They have their own plan. I'm not sure whether they are joined in this COVAX facility, but I want to talk about the COVAX facility. This is actually a vaccine pillar of access to COVID-19 tools accelerator. This is a collaboration, global collaboration, where there are like 172 countries engaged in COVID vaccine global access facility. This includes 80 potentially self-financing countries. That means those countries who can actually finance and also produce the vaccine themselves. And there are 92 low to income countries, low to middle income countries, which have also joined this force, this collaboration. And out of those low countries, low income countries, Nepal is included. So Nepal is covered. So Nepalese people should be already feeling happy that there is something, someone out there who is working for Nepalese people. That means this COVAX facility actually includes in that collaboration Nepal also. That Nepal is already included in that country. That means when the vaccine would be available universally, Nepalese people will get also. That's the idea. The whole idea here, this collaboration, is that they want to bring the pandemic under control via equitable access to COVID vaccine. That's the idea. That because this is such a humongous pandemic of unprecedented scale, that if any population is left behind, they are going to that population is going to suffer. Not only they are going to suffer, they will hit back to the other population as well. So no one is safe unless everyone is safe. That's the WHO's theme now under this facility. That's what is happening. So this is going on. This is international politics, but it is covering Nepal. Just that's what I want to mention here. And there are multiple candidate vaccines, just as Dr. Dinesh Gautam already mentioned. So there are a number of vaccines in different stages, first, second, third, and fourth phases. So they would be delivered as soon as they are available. And these portfolio of vaccines are diverse and they're very actively managed. So that's what I wanted to mention about this. But at the same time, my area of work, that's what I'm involved right now. Yeah, I want to touch on a little bit on that, other than the vaccine and drugs. That is spillover consequences of COVID and response, COVID response. They're also called unintended consequences of COVID-19. As we all know that there has been such a humongous impact on socioeconomic aspects of the whole world. There has been a decline in overall economic growth. WHO estimates that, and World Bank estimates that there will be 5.2% shrinkage in the global economy itself this year. That's what is going to happen. So there is no sector which is untouched by this pandemic. One little virus which has no life of its own is just a strand of nucleic acid, the RNA, small strand of 30 kilobase pair, is causing so much havoc in the whole world that no sector is untouched. Especially the production sectors are hit hardest, reducing the production like agriculture, factories, infrastructure works, all are impacted. And as a result, households have reduced income and people have increased unemployment. And there is a global phenomena of school closure. And also I want to mention here specifically, both in the West and in also South Asia. West, there is a gender and race-based oppression and stigmatization. In South Asia, including Nepal, there is increased gender or caste-based oppression and stigmatization leading to assault and violence, even killing. So this is really a horrendous thing in this time of difficulty, challenging time. People should join hands in hand as brothers and sisters around the world, but things are not happening. There is discrimination going on. That's what
there are many questions coming to the panel. So if you can wrap up, we'll go back to asking you more difficult questions.
Okay, then I'm just finishing in 1 minute. Heightened geographic disparity, there is a lot of disparities. Health services, reduced utilization, and delayed surgeries, missed vaccination, missed visits to doctors like this, and reduced utilization of prevention, and health outcomes, increased conditions such as obesity, hypertension, unwanted pregnancies are also happening because of lockdown in homes. Increased domestic violence is happening, complication of chronic diseases, and some onset of new ones, and increased alcohol and substance use, increased food insecurity and unhealthy, and increased potential years of life loss. There are lots of them, and we are actually working. There should be research. What my advice is, in Nepal, all these areas are happening in health and outside all the sectors. There should be some research, surveys should be conducted on all these spillover consequences. What is happening to the people? People should be at the center of the COVID response. That's why all these unintended consequences that is making their life hell needs to be really cared about. That's all I wanted to say. I don't have many more slides. Thank you very much.
Thank you, Dr. Saab, for an excellent wrap up from the previous episode to this episode. You have really covered the social aspects of it. We all know the COVID-19 has got, effects which we cannot even imagine how far it goes and all these things. But there are a few very technical questions come in, and I will throw in these questions to open to all the panel members, so you feel comfortable to pick up the questions that is relevant to you. And the first question is, I think the airborne, only recently WHO acknowledged airborne beyond 1.6 meter up to 4 meter is virus transmitted. So up to 4 meter in a closed environment setting like hospital or houses or the shopping center, virus can travel up to 4 meters and infecting people. Now people are suspecting that in aerosol mode, if the humidity is right, even in outside atmosphere, like in parking lots or parking places, it can travel beyond 4 meters as an aerosols and also can infect. That's one question. How concerned you are with the longer transmission beyond 4 meter? Is this scientific or not? And would you see that possibility? Second question is the reinfection. There has been in Hong Kong recently reported one patient who was infected, then he was cured. Now he got reinfected after 3 months. So that shows a very serious question. As Bimjana ji said previously, and Dr. Dinesh also highlighted, that we got a memory cells which captures this virus, sequencing, and the next time you would be not attacked if you have an antibodies already developed into our immune system. That means either our immune memory system is not working or virus is clever enough to creating more complications. So how realistic is the reinfection chances? The third is the convalescent plasma. Nepal is using convalescent plasma. FDA approval is not required in countries like in any country has the freedom to use anything they like. FDA only is the guidelines for America, and if you want to use their drugs and things like that, that's the highest standard. But Nepal has already, and in the news it was that they have used convalescent plasma, and there are people who are waiting in line to donate the blood to help. The fourth question is the phytochemicals as a possible route to vaccine. There are a lot of synthetic drugs, sequencing to all these things we all discuss in the modern world. But lately in India, some of the research have shown that phytochemicals could also lead to vaccine. And so from our earlier beliefs in the traditional Ayurvedic medicine to everything, which we inherently take it, but that if you go further into science, they said there is a way to find vaccine from those phytochemicals. So these are the 4 questions. I'll leave the panel to answer these questions to what, as an expert, they feel is the likely scenario, and what is your gut feeling on those questions? Dr. Dinesh, you start with.
Regarding the more than 6 feet, त्यसमा त मलाई के लाग्छ भनेदेखि एउटा त के छ भनेदेखि the size of droplets. If you sneeze or when you speak, अर्को कुरो त के छ भनेदेखि कुनै मानिस बिस्तारै कुरो गर्छ, कुनै मानिस के छ भने अलिकति कराएर बोल्छ. अलिकति कराएर बोल्ने मानिसले डेफिनेटली के छ भनेदेखि त्यो सलाइभाको पार्टिकल्सहरू के छ भने अलिक टाढासम्म जान्छ होला र अब सलाइभाको पार्टिकल्सहरू पनि के छ भनेदेखि कुनै सानो हुन्छ कुनै ठुलो हुन्छ अनि कोही कोही मानिस बोल्दाखेरि मुखभरि के छ भनेदेखि त्यो थुक भनौँ न थुक हुन्छ अनि बोल्दाखेरि कराउँदाखेरि त्यो अझ टाढा जान्छ होला त यी सबै कारणले गर्दाखेरि एउटा के छ भने त्यो डिस्टेन्स डेफिनेटली के छ भनेदेखि डिस्टेन्स बढाएको होला र दोस्रो कुरो के छ भनेदेखि अब बतासहरू चल्यो भनेदेखि अब म बोलिरहेको छु र ठ्याक्क मेरो पछाडिबाट बतास चलेको छ भनेदेखि मैले बोलेको वा मेरो स्निजिङ भएको वा थुक गएको छ भनेदेखि डेफिनेटली त्यो ट्राभल अलिक टाढासम्म ट्राभल गर्छ होला एउटा त त्यो डिस्टेन्सकोमा चाहिँ त्यो फाइटोकेमिकलले चाहिँ भ्याक्सिनमा चाहिँ आई एम नट स्योर एन्ड आई एम नट एक्सपर्ट अफ द्याट वान एन्ड I have no idea whether phytotoxin or phytochemicals will develop in the form of vaccine. अब रहेको कुरो के छ भनेदेखि आयुर्वेदको कुरो जुन भयो अब डेफिनेटली के छ भनेदेखि आयुर्वेद इज ओल्ड ट्रेडिसनल ओल्ड मेडिसिन इन आवर सब कन्टिनेन्ट अब त्यसको के छ भनेदेखि जस्तो हामीले यहाँ औषधिहरू एप्रुभ गर्दाखेरि जुन किसिमको विभिन्न किसिमको रिसर्च गरिन्छ त्यो रिसर्चको आधारमा गएर साइन्टिफिकली प्रुभ गर्यो भनेदेखि आई थिङ्क देयर इज अ पोसिबिलिटिज जस्तो के छ भनेदेखि एनिमल टेस्ट गर्ने अनि त्यसपछि फेज 1 फेज 2 गरेर या फेज 3 ट्रायल गरेर अनिखेरि यो ड्रगले ओके यो कुरो निको पार्छ भन्ने कुरो हेरेर एनालाइज गर्यो भनेदेखि चाहिँ आई थिङ्क देयर आर लट अफ रुम्स फर द आयुर्वेद अल्सो
Thank you. Bimjana ji, any comments on convalescent plasma treatment? You mentioned that Nepal ma paile pani use गरिरहेको छ र तपाईले भने जस्तै it is effective. Do you think it is one of the solution to COVID-19? Or how do you see the convalescent plasma treatment taking front scene?
Convalescent plasma, in theory, it should definitely work. है तर त्यसको कन्ट्रोभर्सी छ अब त्यसमा कुनै पनि अब जस्तो जुन पर्सनलाई अलरेडी इन्फेक्टेड छ डिड दे माउन्ट लाइक इम्युन के एकदमै रोबस्ट इम्युन रेस्पोन्स अर नट कति उनीहरूको एन्टिबडी कति बनेको छ र त्यो कति ड्युरेबिलिटी छ जुन अहिले जुन हङकङको पेसेन्टले देखाइरहेछ त्यो बेसिकली उसको इम्युन सिस्टम कतिको रोबस्ट थियो इनिसियल एक्सपोजरमा र चाहिँ अहिले आएकोवाला चाहिँ इज द्याट बिकज त्यो सुरुमै इम्युन सिस्टम चाहिँ रोबस्ट इम्युन रेस्पोन्स चाहिँ रोबस्ट नभएर हो कि पछि चाहिँ यसको चाहिँ ड्युरेबिलिटी नभएर होस् यसको लागि चाहिँ एउटा लङ्गिट्युडिनल स्टडीको जरुरत छ अहिलेलाई चाहिँ सो यही हो भनेर किनैको साथ चाहिँ भन्न सकिँदैन त्यसको लागि एउटा लङ्गिट्युडिनल स्टडी लाइक वी सुड फलो इट अप अ लिटल बिट लङ्गर अनि सी कि कति टाइम लाग्छ यो कहिलेसम्मलाई चाहिँ यो इम्युनिटी रहिरहन्छ भनेर जस्तै फर इक्जाम्पल तपाईँलाई टिटानस भ्याक्सिन दिएपछि एभ्री 10 years यु निड टु काइन्ड अफ रिन्यू द्याट होइन त्यसको एउटा सर्टेन टाइम हुन्छ तर मिजल्स भयो मिजल्स यु नर्मली डोन्ट गेट रिइन्फेक्टेड तर जब यो कोभिडको केसमा आछ भने तर त्यो मान्छेको अर्को के छ भने माइल्ड छ त्यसैले यो कम्प्लिटली न्युट्रलाइजिङ एन्टिबडी भन्ने हुन्छ त्यसले चाहिँ त्यो भाइरसलाई एन्ट्री गर्न दिँदैन न्युट्रलाइजिङ एन्टिबडी नबनेको भए तापनि इम्युन सिस्टमको अब टी सेल्सले र बी सेल्सले मिलेर एटलिस्ट सम काइन्ड अफ इम्युनिटी चाहिँ दिइरहेको होला त्यही भएर त्यो एउटा चाहिँ एकदमै माइल्ड हुन्छ त्यो माइल्ड फर्ममा हुन्छ अहिले जुन हङकङको मान्छेलाई देखाइरहेको छ उसको माइल्डै छ उसको सिम्पटम्स चाहिँ द्याट्स वाट आई हेभ रेड सो फार माइल्डै छ तर एक्ज्याक्टली यकिनकै साथ भन्नलाई यसको ड्युरेबिलिटी र स्ट्रेङ्थहरूको लागि चाहिँ लङ्गिट्युडिनल स्टडीको जरुरत पर्छ जस्तो लाग्छ मलाई
यसमा म अर्को एउटा सानो कुरो के थप्छु भन्दाखेरि कन्भल्सेन्ट प्लाज्माकोमा चाहिँ अब यसमा एउटा कुरो त के छ भनेदेखि यसको ठुलो स्टडी भएको छैन ठुलो भन्दाखेरि लार्ज स्केलमा स्टडी भएको छैन त्यसैले गर्दाखेरि अहिले जुन अहिले कन्ट्रोभर्सी जुन भइरहेको थियो र के अरे इमर्जेन्सी एप्रुभल गर्यो एफडिएले फेरि अब त्यो लार्ज स्केलमा भएर अब त्यसको स्टडीको डेटाहरू आउनु बाँकी नै छ वास्तवमा त्यो डेटाहरूलाई एनालाइज गरेपछि चाहिँ के छ त इफिकेसी वा यसको स्टेबिलिटी वाट एभर होइन एउटा कुरो त त्यो भयो दोस्रो कुरो के छ भनेदेखि अब लेट्स सी अब मलाई कोभिड लागेको थियो म निको भएँ मेरो प्लाज्मा मैले दिएँ अर्को यसको इम्प्याक्ट चाहिँ के हुनसक्छ सपोज मलाई अरू कुनै डिजिज छ लेट्स से र डिटेक्ट गरेको छैन एचआइभी छ अरे भनेपछि अर्को जुन रेसिपिएन्ट जुन हुन्छ द रेसिपिएन्ट विल गेट अनदर डिजिज के मेबी त्यो कोभिडले बाट बच्छ होला त अरू डिजिज चाहिँ ट्रान्समिट हुनसक्छ यी अलिकति चाहिँ दुई चारवटा कुराहरू के छ भनेदेखि त्यहाँ विचार गर्नुपर्ने हुन्छ त्यसमा
It will take time.
Rajuji,
No, for sure.
can I talk?
Go on.
Plasma को treatment को कुरामा चाहिँ जुन अहिले गौतम सरले भन्नुभयो नि फर्स्ट थिङ इज डिजिज क्यारी गरेको छ कि छैन त्यो चाहिँ हैन नन डिजिजहरुको डायग्नोसिस भएकै हुन्छ सेकेन्ड थिङ व्हेन यु ड्रप प्लाज्मा मोस्ट अफ द भाइरस आर नट देयर इन प्लाज्मा त्यो फिल्टर गरिसकेको हुन्छ ब्लडलाई अनि सेकेन्ड थिङ इज प्लाज्मा वर्क्स भने हैन कि बट इट्स अ लास्ट रिसोर्ट अफ द पेन्डेमिक सिचुएसनमा र सार्स कोभ-2 को केसमा के छ यसको स्पाइक प्रोटिन जुन छ नि त्यसले त्यो एसी बाइन्डिङ डोमेनलाई चाहिँ अलवेज खुला राखेको हुन्न त्यो प्रोटिन जहिले पनि ढाकेर बसेको हुन्छ एकैछिन त्यसले आई थिंक इट्स इन नानो पिक्चर सेकेन्ड्स खोल्छ र बाइन्डिङ हुन्छ अदरवाइज इट क्लोजेस इट सो द बडी क्यानोट गेट द इम्युन रेस्पोन्स त्यसकारण तपाईले स्पाइक प्रोटिनको अगेन्स्टमा मात्र यदि प्लाज्माको एन्टिबडी खोज्नु भयो भने त्यसले काम गर्न नसक्छ तर कथम कदाचित यदि त्यो प्रोटिन खुलेको बेला र इम्युन रेस्पोन्स भएर त्यो एन्टिबडी प्रोडक्सन भएको छ भने चाहिँ त्यसले प्रोबेबिलिटी छ प्लस सेकेन्ड पार्टमा के छ भने यो भाइरस इट मेक्स टनल विदिन द सेल्स जुन तपाईहरु दुवैजनाले देखाउनु भने एक्टोलाइसिस भएर बाहिर आउनु सबै भाइरस बाहिर आउँदैन भित्र भित्रबाट पनि जान्छ त्यसले गर्दा इम्युन एकदम हाइड गरेको हुन्छ त्यसकारण यो बाहिर ब्लड सेलमा आएर यसले इम्युन रेस्पोन्स गराउनु भने कि स्पाइक ल्यायो कि मेम्ब्रेन प्रोटिन ल्यायो कि एनवेलप ल्यायो मेनली स्पाइक ल्यायो त्यो स्पाइकको जुन एसी बाइन्डिङ डोमेनको जुन छ त्यो चाहिँ के भने इफ यु क्यान सी मी or not it's like like this and in a picture seconds it opens anchors otherwise it closes down त्यसले गर्दा चाहिँ स्पाइकमा के औषधि बनाउन गाह्रो भइराको and another thing is what I want to ask Bimjana is it's very nice to see you Bimjana म कसमको क्लासमेट हो स्कुलको
ए हजुर नमस्ते
प्रमोद दाइ
अनि अर्को
यसो we flew from Delhi while you were studying there in the same plane अनि कसमसले भनिरहेको थियो म अमेरिका आउँदा त भेट्न पाएको थिएँ इट्स नाइस टु मलाई तिमीसँग एउटा के चाहियो भने नि यो टी लिम्फोसाइट्सलाई एक्टिभेसन गर्नलाई CD45 RA आइसोफर्म चाहिन्छ स्प्लाइसिङ फर्म तर इन सम अफ द इम्युन जस्तै लाइक आर्थराइटिस यस्तो केसेसहरुमा त्यो NF kappa B 1 इन्हिबिटर लाइक प्रोटिन 1 को चाहिँ पोलिमर्फिक फर्म हुँदाखेरि CDRO फर्म हाई हुन्छ कि र तिमीहरुले पाएकै छैन कोभिडमा चाहिँ CD45 RO फर्म हाई भएर अनि टी लिम्फोसाइट्सहरु चाहिँ एक्टिभेसन कम भएको मैले सुनेको छैन त्यो
त्यो मैले एक्ज्याक्टली पढेको चाहिँ छैन तर आरए र आरओ भनेको चाहिँ नाइभ टी सेल र मेमोरी टी सेल्स हो सो मेमोरी टी सेल्स चाहिँ हुन्छ त्यो त्यसले पनि अर्को इम्युनिटी दिन्छ भन्ने छ मेमोरी टी सेल चाहिँ कस्तो भने एडप्टिभ इम्युन सिस्टम हो फर्स्ट त इनेट भयो इनेटमा चाहिँ आइएफएन गामा त्यसले इन्टरफेरोन गामा त्यसले युज गर्ने भयो त्यो एक्ज्याक्ट त्यो फर्स्ट डिफेन्स भयो सेकेन्ड डिफेन्समा चाहिँ एडप्टिभ इम्युनिटी भयो जसमा चाहिँ डेन्ड्रिटिक सेल्सले त्यो एन्टिजेनलाई क्याप्चर गरेर अनि अब एमएससी जिनमा राखेर चाहिँ प्रेजेन्ट गर्छ टी सेललाई टी सेलले चाहिँ के गर्छ नि एट्याक गर्ने काम टी सेल पनि फेरि डिफ्रेन्ट टाइपको छ अब जस्तै रेगुलर टी सेल
मेमोरी टी सेललाई चाहिँ इनएक्टिभेसन गरेको छ कि टी सेल एक्टिभेसन लिम्फोसाइट्सहरु एक्टिभेसन नभएनाले अलिकता इम्युन सिस्टम गर्न गाह्रो भयो तर त्यसैले गर्दा के हो भने साइटोकाइन बर्स्ट गर्दियो त्यसले गर्दा भयो यसमा चाहिँ प्यारलली के छ भने गाह्रो एउटा त साइटोकाइन बर्स्ट गर्नलाई त रोक्न सकिन्छ TNF अल्फा इन्टरलेकिन 6 इन्टरलेकिन 15
IL-6 TNF अल्फा
इन्हिबिटर्स राखेर
इन्फ्लेमेटरी साइटोकाइन्स these are all pro inflammatory cytokines
dexamethasone prednisolone activate
right यो prednisone यिनीहरु सबै स्टेरोइड भयो यो स्टेरोइड्सहरुले चाहिँ यसलाई कर्ब गर्छ साइटोकाइन्सलाई इनहिबिट गरेर आई मिन यसलाई यो कर्ब साइटोकाइन स्टर्मलाई कर्ब गर्छ भनौं न
because I'm talking this because we have a tomorrow Zoom meeting for planning for experimental trial in Nepal for your phytochemicals
the doctor I think it's a very excellent go ahead
No, go ahead. No, I was going to say that I don't know much about phytochemicals.
I'm not also expert in phytochemicals, but I mean, since it's been used for years and years, and the active excipient active compounds are approved by FDA for some. Let me get the charts right.
One of my colleague, the reason why I ask is India is ahead in this game, phytochemicals and CDRI, Central Drug Research Institute, one of my friends, active compound from isolated is in the clinical trial. Only was in the recent media. He was my colleague, PhD, together we did. So that's attracting. But as Dr. Dinesh Gautam says, this reinfection is a very big issue because either it is the body memory cells of antibodies is disappearing or the virus is creating a different kind of mechanism to suppress that memory. There are lots of things, as you said, Dinesh, Dr. We need more of studies. That's why FDA and all, until such time people are using, but they requires lots and lots of studies to understand the effect of virus on our memory cells and T cells and B cells and kind of things. So I think it's a very great discussion. Thanks to Parmodji. I think Nepal is also seems to be doing a lot of active research at the moment, and this kind of interaction and linkage with the diaspora would definitely I know few startups in Nepal who are really interested during artificial intelligence and trying to use that into the COVID space and kind of things. I myself involved into a sensor area, trying to, there was a report that Israel has developed a mouthwash. So you can gargle your mouth and then put it into a pouch back at fluorescent. To give you the detection. So there are lots of, and I'm into the sensor area of COVID space. So I find these things fascinating. Now I come to the Dornaji, you are an epidemiologist, and I can see we discussed a lot about the molecular biological this thing, but as an epidemiologist, are you happy and content with the way the epidemiologist research or the way our tracing, tracking, or whatever strategy we put in Nepal is working? If not, what as an expert you suggest that should have been done?
Yeah, that's a very good question. First, let me touch on a little bit on these areas, aerosol infection, reinfection, convalescent plasma, and phytochemical. All these, especially last three, are related with the level of immunity in the population. Whether it will have reinfection or not is based on how much, whether or not the person is protected by the immune system, by the specific antibodies. That's why what as an epidemiologist, what I can say is more and more research and surveillance should be done on the level of immunity in the population. How many people are exposed, and in what way they have been exposed? Are they exposed due to vaccination? They got the vaccine, which is not the case here now. Basically, it is through the infection. Exposure is now only the infection. How many? What is the level of infection, and an individual person, how much protective immunity the person has, antibodies? That will determine whether or not the person will be reinfected. For that purpose, actually on April 2, I wrote one op-ed in Republica. Republica, My Republica, where I had mentioned massive scale of testing, which is not happening in Nepal. That should happen, because even to know whether or not people will be protected, we need to have serological tests done so that we know how many people are protected with the antibodies. Even we should have the titer level, not just positive or negative. Positive and negative will not solve the problem. We have to know what is the level of immunity people have. And more people are exposed, then if there are maximum number, at least 75% people needs to be exposed in some way or other to create the herd immunity. That is not going to happen right now. It's only the solution is physical distancing, basically, primarily. But at the same time, we should begin to examine the level of immunity in the people who have been exposed, whether or not they will be likely, the probable of having reinfection. That's one issue. For that purpose, we need to really have this contact tracing and continuous testing through serological tests for those people who are exposed already or potential for having exposed. For those who are suspected, they should be examined by the RT-PCR testing, nucleic acid test, amplification testing we should have. So this testing has not been good enough, but at the same time, Nepal seem to not have too many serious cases, which requires medical attention, or even if they are exposed in a massive scale, they have not been exposed in a way that they would show the symptoms, or they would need hospitalization or critical care. Critical care is very rare anyway. That might be because of the general protective immunity people have. You touched on BCG earlier. BCG is repurposing the vaccine, but that vaccine, I'm suspecting, I'm not the expert on that, but my thinking is, maybe it is the question to Dr. Dinesh Gautam. This repurposing is not exact. Is it exactly to counteract against the virus as a vaccine per se, or it is just to boost the general immunity through the other mechanism of immunity, having a better immune power in the system through the T cell or other means of defense in the body.
Okay,
Is it really exactly the vaccine against the virus, or it is just increasing the immunity? That would be my question, because that will determine the case of phytochemical also. Phytochemical is also similar, is going to have the same fate. Phytochemical is not really a vaccine or drug. It will be boosting the general immunity of the body. That's what I'm thinking.
Let me speak.
Okay.
I think we're confused.
Dr. Dinesh Gautam Pachi, I'll just mention, Dr. you come now. We got only a few minutes left, so I will have to ask you one important question before we close the session. And now I will let Dinesh ji to reply to the Dr. Dinesh Rasali ji.
Okay, Dr. Rasali, that is a really very interesting question. And I was also wonder, I mean, when I heard about BCG vaccine. So BCG vaccine वास्तवमा के छ भनेदेखि we know that tuberculosis ले चाहिँ lungs मा infection गर्छ र कोभिड ले पनि के छ भनेदेखि lungs मा infection गर्छ. So BCG vaccine ले चाहिँ कोभिड को अगेन्स्ट मा भाइरस को अगेन्स्ट मा चाहिँ के छ भनेदेखि इम्युनिटी डेभलप गर्ने भन्दा पनि जुन तपाईले भन्नुभयो के छ भनेदेखि त्यो इम्युन सेल्सहरुलाई स्टिमुलेट गर्ने त्यो लंग्स को मैले बुझेको आधारमा चाहिँ त्यही हो. के छ भनेदेखि त्यो BCG ले इम्युन सेल लंग्स मा भएको इम्युन सेल्सहरुलाई रेस्पिरेटरी सिस्टममा भएको इम्युन सेल्सहरुलाई बुस्ट गर्ने, जसले गर्दा के छ भनेदेखि कोभिड भइसके भाइरस गइसक्यो भनेदेखि चाहिँ त्यसले फाइट गर्छ र के छ भनेदेखि सिरियस कन्डिसन हुँदैन भन्ने कुरा.
Thank you, Dr. Saab. I think there's one more question coming before we close the session. And
I have one small question to के रे हाम्रो नेपालको लिसनर्सहरुलाई. भर्खर मैले आज सुनेको के छ भनेदेखि चाइना, रसिया र अक्सफोर्ड युनिभर्सिटी तीनवटा उहरुले चाहिँ फेज 3 कोभिड भ्याक्सिन ट्रायल गर्दैछ रे नेपालमा भनेर. अब त्यो कुन लेभलमा कसरी भइरहेछ वा कसरी गर्ने हो भनेर who is going to authorize or who is going to give के छ भनेदेखि green signal?
That's a very important question, Dr. There has to be a regulatory authority in Nepal, Ministry of Industry Antargat, मैले थाहा पाए अनुसार, who are responsible to protect, to filing for patents, copyrights, and all other things, trade names and all. So definitely, it's a good question to the audiences, and when we get answered, Dr. we'll get back to you.
Okay.
And to Dr. Dr. Rasali ji, तपाईले राम्रै भन्नुभयो. I think we need to encourage. People are not encouraged very easily. So even in Australia, we give free money. money to go for testing. Once you get infected, you get $300 to get to go for testing. And once you get proven test positive, you get $1,400 for your 14 days isolation. So it's not an easy job, but at the end of the day, Dr. Saab, I think I learned a great deal interacting with such a enormous, brain power of, molecular biology and immunology. And the last question I can ask you, which audience would like to hear from you, is that as an expert, what one message as a scientist you want to give it, just one or two, one probably killer message to the government of Nepal as a scientist. So you can start from Dr. Dinesh to Bimjanaji to Donaji.
डेफिनेटली के छ भनेदेखि अब यस्तो आत्तिएको बेलामा अब सबैलाई वास्तवमा के छ भनेदेखि ड्रग त डेफिनेटली के छ भनेदेखि अहिलेसम्म यसो विचार गर्दाखेरि प्रमिसिङ कुनै पनि छैन खासै भन्ने हो भनेदेखि अब रहेको कुरो के छ भनेदेखि भ्याक्सिनको कुरो सो मोस्ट लाइकली चाहिँ आई एम भेरी अप्टिमिस्टिक द्याट जनवरीसम्ममा पक्कै पनि के छ भनेदेखि भ्याक्सिन आउँछ र मोस्ट लाइकली विदिन फेब्रुअरी मार्चमा चाहिँ जेनरल पपुलेसनले पनि पाउँछ होला भ्याक्सिन। अब रहेको कुरो के छ भनेदेखि अब फेज 3 गरेर अब मानिसमा हामीलाई दिउन्जेलसम्म तिनीहरूको त्यो सेफ्टी इफिकेसी र अब कतिवटा डोज लिनुपर्ने वेदर वी हेभ टु टेक एनुअली अर 2 doses per year, till we don't know it.
Thank you. Bimjanaji, what's your message? You are on mute. You are on the mute.
Can you hear me now? म चाहिँ के भन्छु भने मैले पिक्चरमा देखेँ कि 2 घण्टाको लागि बजार खोल्छ मान्छे सब भिड भएर जान्छ। आई थिंक that has to do with how the infodemic is not being managed properly. हुन त डाक्टर रसालीले बेटर भन्नुहुन्थ्यो होला यो, तर इन्फोडेमिकलाई म्यानेज गर्नु पर्यो एकदमै इम्पोर्टेन्टली चाहिँ सबैभन्दा पहिला। मान्छेमा अवेरनेसै छैन कि, त्यो नभएको भएर बन्द गरेर राखेको छ, कर्फ्यू गरेर खुल्ने बित्तिकै 2 hours भित्र विदिन दैट 2 hours एभ्रीबडी इज शपिङ एट द सेम टाइम इन द लाइक एकदमै क्राउडेड फर्ममा मास्क निकालेर गरिरहेको हुन्छ। सो इट पिट्स द पर्पस। नम्बर 1। नम्बर 2 सबैभन्दा मलाई मन दुखेको कुरा चाहिँ के देखेँ मैले भने नेपालमा फ्रन्ट लाइन हेल्थ वर्करहरूलाई असाध्यै नै हेला गर्न खोज्ने नर्सेसहरूलाई आई जस्ट डोन्ट इभन अन्डरस्ट्यान्ड वाइ द्याट्स इभन द केस। They should be like praised and they should be taken like angels actually. And why is that so opposite in Nepal? यो चाहिँ मलाई एकदमै चित्त नबुझेको कुरा हो। So I just wanted to kind of hammer that in and let that sink in.
Australia पनि यही problem छ। Health workers are more exposed because they are facing crisis from a very close distance. Australia
र एउटा सानो कुरो मैले चाहिँ के भन्छु भने जुन मैले आफै प्र्याक्टिस गरिरहेको छु, मैले कुनै साथीभाइलाई कहीँ भेटेँ भनेदेखि इभन पसलमा जाँदाखेरि मेरो नजिक कोही आयो भनेदेखि म वास्तवमा के छ भनेदेखि रुटिन के अरे नोट लेखिहाल्छु कि, किनभने बिर्सिन सक्छ नि। जुन यिनीहरूले के छ भनेदेखि 14 days क्वारेन्टाइन भनेर भनेको छ नि, जस्ट इन केस म बिरामी पऱ्यो भनेदेखि ओके मैले यो 14 दिनभित्रमा कसलाई भेटिया थिएँ र पसलमा कहाँसम्म पुगेका थिएँ, मेरो पछाडि यदि हुलिया केही छ भनेदेखि त्यो हुलिया पनि लेखेर राखेको हुन्छ र कति टाइम मैले बिताएँ त्यो पसलमा वा साथीभाइसँग त्यो पनि मैले लेखेर राखेको छु। आई थिंक दैट इज भेरी गुड प्र्याक्टिस टु।
That's really good. That's very एकदमै awareness.
That's really incredible.
And Dornaji, what's your message?
मेरो मेसेज त के छ भन्दाखेरि चाहिँ अब सबै आई इन्डोर्स whatever both of our experts had said. Bimjanaji is very practical in what she is observant and she is advising. I like those. At the same time, मेन चाहिँ जे पनि इन्टरभेन्सनहरू हुन्छ यो कोभिडको त्यो सबै साइन्स बेस्ड एभिडेन्स हुनु पर्यो। त्यसको लागि स्टडी गर्ने चाहिँ एउटा परम्परा हुनु पर्यो। स्टडी गरेर त्यसको आधारमा रिपोर्ट चाहिँ ल्याएर अथोरिटी टेक्निकल अथोरिटीले, पोलिटिकल अथोरिटीले होइन, पहिला टेक्निकल अथोरिटी मेडिकल साइन्टिस्टहरूले त्यसलाई चाहिँ एप्रुभ गरेपछि अनि गभर्मेन्टले डिसिजन गर्नु पर्यो। यस्तो चाहिँ नगर्नको कारणले त्यहाँ बिहाइन्ड द सिन लकडाउन त गरियो। नेपाल हेज बिन भेरी सक्सेसफुल इन लकडाउन कन्टेनिङ द डिजिज, तर यसको कस्ट चाहिँ प्राइस चाहिँ नेपालले जनताले चाहिँ धेरै भोगेको छ, धेरै मान्छेहरू चाहिँ दुःख पाएको छ। त्यसले गर्दा त्यो बिहाइन्ड द सिन के भएको छ, यो अनइन्टेन्डेड कन्सिक्वेन्सेसहरू सबै स्टडी गरेर त्यसको आधारमा चाहिँ डिसिजन गरेर अब गभर्मेन्टले पोलिसी ल्याउनु पर्छ। एउटा राहतको कार्यक्रम पनि त्यो गाविसमा चाहिँ त्यो चामलको पोकाहरू बाँडेर हुँदैन, त्यो चाहिँ अहिले फुड इन्सेक्युरिटी पनि एउटा चाहिँ ठुलो समस्या हो। यो संसारभर नै फुड सेक्युरिटी हेज बिन वान अफ द अनइन्टेन्डेड कन्सिक्वेन्स। फुड सेक्युरिटी भनेको चामलको पोका दिनु चाहिँ फुड सेक्युरिटी होइन। मैले आज के खान चाहन्छु त्यो खान पाउनु त्यो चाहिँ फुड सेक्युरिटी हो। त्यो मान्छेले के खान चाहन्छ त्यो मान्छेलाई उसलाई चाहिँ राहत पैसाको रूपमा चाहिँ दिनु पर्थ्यो। त्यो चामल बाँडेर हुन्न। सेकेन्ड फेज आएर सेकेन्ड वेभ आएर चाहिँ हामीलाई त्राही पायो भने त्यतिखेर लर्निङ के हो भने अलिकति चाहिँ स्टिमुलस, इकोनोमिक स्टिमुलस दिनुपर्छ। त्यो चाहिँ एउटा क्यासमा पैसा दिएपछि त्यो मान्छेहरू चाहिँ इम्पावर हुन्छ। उसले कस्तो खालको खाना खान मन लागेको छ, कसरी खान पर्छ उसलाई थाहा छ। सरकारले डिक्टेट गर्ने होइन कि यो चामलको एक पोका लगेर खाऊ। त्यो चाहिँ चामल बाँड्ने चाहिँ त्यो एकदमै दया गरेर हेला गरेर दिने चिज हो। एउटा डिग्निटी, ह्युमन डिग्निटी भएन त्यहाँनिर। त्यो प्रकारलाई पनि सेन्सिटिभिटी सबै प्रकारको हुन्छ। किनभने एउटा मेन्टल हेल्थ, मेन्टल इलनेस, स्ट्रेस संसारभरि नै यो कोभिडले ल्याएको वान अफ द मेजर कन्डिसन हो, अनइन्टेन्डेड कन्सिक्वेन्सेस। त्यसलाई पनि विचार राख्नुपर्छ भन्ने मेरो चाहिँ सोचाइ हो।
It's a very complex problem and a very inside information from so many few experts, very practical solution. मेरो आफ्नो तर्फबाट चाहिँ त नेपालमा इफेक्टिभ कोअर्डिनेसन डिफ्रेन्ट लेभलमा, गभर्मेन्ट लेभलमा पनि, टेक्निकल लेभलमा पनि, हेल्थ लेभलमा पनि त्यो एउटा चाहिँ हुन्छ नि। जस्तो एउटै हाम्रो अस्ट्रेलियामा एउटै सेन्टरले सबै डिल गर्छ भने जस्तै फेडरल कमिटीमा स्टेटको हेल्थ अफिसियल सबै बसेर एउटा त्यो लेभलको कोअर्डिनेसन इज लेकिङ। एनीवे we finished well in time. Actually we went beyond time. Our schedule was for 1.5 hours. I myself felt mesmerized by Dr. Dinesh and Bimjana ji and Drona ji ko message. I'm sure audiences would have benefited much. And for your information, this is recorded and we will keep that uploaded into the NRNA Facebook later, the recorded version, so you can go and visit. And also with your permission, I would like to have your slides given permission to me, the PDF file of it, to be shared later on in NRNA website. So if you don't have problem, give me that in writing and then we will put it into our website. So without this thing, we finished well in time. Thank you once again, Dineshji. Go personally.
Thank you.
Good to meet
Yeah,
you.
thank you all.
Thank you, Rajuji.
Thank you, everyone.
Thank you.
And Purnaji, thank you so
Good
much.
morning.
Thank you.
Yeah, good morning.